I think we can start now. The time is exact 5 p.m. And since we have all the delegates as well as the members also, so we can begin with.
For whom we are waiting?
Divya, please start.
Okay.
Yes, yes.
Good evening, everyone. I am Divya Rai. I am a practicing clinical psychologist, and I would like to take this opportunity to warmly welcome all of you on behalf of Indian Mental Health and Research Center to its first webinar, the first of the webinar series. Indian Mental Health and Research Center is a unit of Indian Progressive Youth Forum dealing with psychological and behavioral issues of children, adolescents, adults, and geriatric population. It is a continuously growing organization of its own kind, aiming at helping individuals to lead a happy, meaningful, problem-free life. It is based on the concept of holistic health aiming at healthy body, mind, and soul. It is run by specialized team of psychiatrists, RCI licensed clinical psychologists, counseling psychologists, and educationists. Journal of Advanced Research in Sciences and Social Sciences is an open access multidisciplinary publication from IMHRC. Internship programs for various students of psychology who are pursuing graduate, postgraduate, and programs from different universities is offered. Fellowship programs is also offered at IMHRC. COVID-19 helpline, and we are here with a webinar series. As the coronavirus pandemic rapidly sweeps across the world, it is inducing a considerable degree of fear, worry, and mental health concern in the people of all age groups. In public mental health terms, the main psychological impact to date is elevated rates of stress, anxiety. But as new measures and impacts are introduced, especially quarantine and its effects on many people's usual activities, work, level of loneliness, depression, harmful use of substance, and suicidal behavior and ideations are also expected to rise. So, IMHRC has come up with COVID-19 mental health support program, which aims to identify, prevent, and on the treatment of all kinds of mental health concerns that people are going through in this difficult time. IMHRC has been a front runner in the mental health care sector and has been providing treatment, psychosocial, and rehabilitative support to the individuals going through mental health problems. The current COVID-19 mental health support program is one such step taken in the direction of mental health work. In order to increase our understanding and awareness about various mental health issues arising in this pandemic, IMHRC has taken this initiative to gather at one platform and to listen to our experts on these mental health concerns. A very gentle reminder to all our participants that our webinar will be streaming live on YouTube and Facebook. I hope that all of you will be an active participants in today's webinar. Kindly keep a notepad and a pen ready with you so that you don't miss any of our experts' advice on how to deal with your mental health in this pandemic. In the end of the webinar, we'll have a brief question and answer session. I'm very pleased and honored to introduce the very eminent keynote speaker of today's webinar, Professor S.Z.H. Zaidi, sir. Sir is currently positioned as professor and head of Department of Clinical Psychology and Director, Amity Institute of Behavioral and Allied Sciences, Amity University, Uttar Pradesh. Sir is a licensed clinical psychologist with 42 years of teaching and clinical practice and trained at Central Institute of Psychiatry, Ranchi, NIMHANS, Bangalore, and Mental Health Department of Council, Glasgow. He is a visiting faculty of CIP Ranchi, Mumbai University, Tata Institute of Social Sciences, Mumbai, and many other international institutes. He has been appointed as member Zonal Coordination Committee of Rehabilitation Council of India, New Delhi for Central Zone. He has many research publications and book chapters to his credit. He is an ex-editor, Indian Journal of Clinical Psychology. He is a recipient of National Award in Empowerment of Persons with Disabilities awarded by President of India and S.C. Kang Oration Award for his contribution in promotion of clinical psychology in India. Over to you, sir.
Thank you, Divya. Thank you very much. मेरी आवाज सुनाई दे रही है?
जी सर, जी सर.
Okay. Well, first of all, that I must thank organizer, particularly Youth Forum, who had been very active पिछले कुछ सालों से बड़े relevant programs, बड़े relevant webinars, कभी offline, कभी online इन्होंने organize किया है. And that shows that the youth has taken the responsibility of the future. वैसे तो मैंने इस कोविड इशू के ऊपर कई प्रोग्राम्स किए, मेरी एक बुक भी एडिटेड है इसके ऊपर, कई आर्टिकल्स मैंने लिखे, बहुत सारे वेबिनार्स किए, बट आज मैं अपने को ज्यादा इक्विप्ड, ज्यादा एक्सपीरियंस समझ रहा हूं, क्योंकि कल तक की जो इंफॉर्मेशन मेरी थी वो पढ़ाई थी, रिसर्च रिव्यू बेस्ड थी, पेशेंट से जो मैंने सीखा था, जो सुना था, जो उनसे बात किया था, उसके ऊपर बेस्ड थी. बट आज मैं खुद अपने सेल्फ एक्सपीरियंस से आपसे शेयर करना चाहता हूं कि व्हाट आर द फीलिंग्स ऑफ ए कोविड पेशेंट, बिकॉज आई हैव बीन a COVID patient last 10 days before. And my wife is still in the hospital. So I am all the three, whichever one can think of it. Therapist, patient, and caregiver. No one could be so rich in experience than I. So what I am saying, it is not based on any theory. That is why I am not showing you any PPT. I'll simply take your 10, 15, 20 minutes, and I hope that you would bear with me. No PPT, no definition, no quotation, no statistics. Direct first-hand experience. And that is why I think that this seminar is more relevant, because it is organized by inviting person who can share with you the first-hand experience beyond the book. Books are available, you can go and read. You can go and consult any ebook or hard copy. But what I'm sharing with the Vivo in that first-hand direct experience. Well, there are two words which all through is being used right from the title of the seminar, और जो दिव्या मैम ने इस प्रोग्राम को इंट्रोड्यूस किया उस रेफरेंस में, one is COVID-19 and another is a mental health. Well, I would like to first explain scientifically what we really mean by mental health. This is a word which has been used for ages. People have been talking more about the mental illness, mental sick, mentally derailed, all type of words, decent or indecent, half mind, full mind, whatever say, half mind, full mind, whatever words they have been coming in their mind as per their background, cultural background, their educational background, they have been using about it. But hardly anybody has explained or talked about there's something like health. When we talk about the health, we only think about the blood pressure, sugar level, weight, biomass. अगर हमारा ब्लड प्रेशर कम हो रहा है तो हमारी हेल्थ खराब है, अगर बढ़ रहा है तो हेल्थ खराब, डायबिटीज है तो हेल्थ खराब, खांसी आ गई तो हेल्थ खराब. Nobody has talked about or try to understand. I'm talking about general public. I'm not talking about the professional. You are aware of it, because this program is not only for professional, it is for general public, as I'm told. इसलिए मैं लैंग्वेज भी वही इस्तेमाल करूंगा जो इन लोगों को जनरल पब्लिक के लिए ज्यादा यूजफुल हो, क्योंकि इट इज अवेयरनेस प्रोग्राम बेसिकली. तो ये मेंटल हेल्थ होता क्या, हेल्थ क्या चीज है? पहली बात तो हम आपसे डिस्कस करेंगे कि हेल्थ सिर्फ बीमारी के ना होने को नहीं कहते हैं. इट इज नॉट इन द एब्सेंस ऑफ डिजीज. ये फिजिकल, साइकोलॉजिकल, सोशल वेलबींग है एंड स्पिरिचुअल वेलबींग. यानी जब आपको अंदर से अच्छा लगे कि यहाँ सब चीज सब ठीक ठाक चल रहा है, मानसिक रूप से भी हम स्वस्थ हैं, सब चीज ठीक ठाक चल रहा है, हम खुश हो सकते हैं, हम रो सकते हैं, समय पर जरूरत पर रोना भी एक बहुत अच्छी निशानी है मेंटल हेल्थ की. वरना लोग कहेंगे ब्लंट है, ये इतनी बड़ी घटना घट गई, इसकी आंख में एक आंसू नहीं आया, इसका खून सफेद हो गया. सो मेनी थिंग्स, सो मेनी कमेंट्स वुड बी गिवन टू पर्सन हु डजंट नो हाउ टू वीप, who doesn't know how to feel happy, who doesn't know how to feel boredom, कि यार कुछ सुबह शाम तक कुछ करने का हम बोर हो रहे हैं. तो बोर होना कोई मेंटल हेल्थ खराब होने की निशानी नहीं. इट्स वेरी वेरी गुड. यू आर नॉट having any stimulation, there is no activity, there is no work to be done. So all these things comes under psychological well-being. Social well-being, when you are interacting with the people, when you are working, when you are earning money, and you are feeling good from within. Feel good feeling, not that political feel good, but the real feel good. When you feel it, it means that you are having good mental health. And spiritual health, when you have full faith and when you are fully satisfied with your karma, कि हमारे कोई कर्म ऐसे नहीं है जिससे हमने कोई किसी का दुख पहुंचाया या किसी को खराब पहुंचाया या भगवान हमसे नाराज होगा. भगवान के सारे इंस्ट्रक्शन, सारी पॉलिसीज को, सारी चीजों को हमने फॉलो किया है. दो रिलीजन एंड स्पिरिचुअलिटी, these are two different things, but these are all overlap also. So these are the mental health issues. Now, what are the indicators? How you can further define it? Your mental health. Mental health is that when you have full realization about your potential. What I have been telling so far, it was the outcome and result. You are finally at the end of the day, you are satisfied. You are satisfied. You are sleeping well, क्योंकि आपने जो कुछ भी करना था आपने किया. You are fully satisfied. उसके 4-5 एलिमेंट्स हैं, वो मैं आपको डिस्कस करूंगा ताकि उसको मैं अगले जो मैं कोविड के बारे में शेयर करना चाह रहा हूं उससे लिंक कर सकूं। पहला क्या है कि जब आप या कोई भी व्यक्ति अपने पोटेंशियल्स के बारे में जानता हो, व्हाट आई कैन डू, व्हाट आई कैन नॉट डू इट। देखिए अक्सर ऐसा होता है कि हम या तो अपने को ओवर एस्टिमेट करते हैं तो निराश होते हैं, या अंडर एस्टिमेट करते हैं तो निराश होते हैं। One should know where they stand, not only physically, economically, भाई हमारे पास इतना पैसा है तो हम पैरामीटर्स में हैं, हम अपर इकोनॉमिक ग्रुप में या लोअर इकोनॉमिक ग्रुप में या मिडिल क्लास है, नॉट लाइक दैट। What are my capacity to, what are my potentials to cope up with normal human stress. Potential, not potential to purchase a Mercedes car or potentials to purchase a very big house or apartments. No. Potentials to cope up with stress. कि हमारे में स्ट्रेस को बेयर करने की कितनी क्षमता है। जस्ट लाइक दैट, अगर आपका होमोग्लोबिन लेवल 14% या उससे ज्यादा है, it means that you have sufficient blood in you and you have good immunity power, and that can be gauged, that can be evaluated. If you do not have sugar level higher, your potential to fight any infections. So the same way, हमें ये मालूम नहीं होता, हमें ये मालूम होना चाहिए कि हमारा जो मेंटल हेल्थ है वो कितना हमारी एबिलिटी है, कितना हम स्ट्रेस को कोप अप कर सकते हैं। बट अगेन स्ट्रेस तो आपको सबको मालूम है, दबाव, मानसिक दबाव जब ज्यादा वर्क होता है, जब बहुत सारे धुंध होते हैं दिमाग में, बहुत सारे गुत्थियां होती हैं, कॉन्फ्लिक्ट्स होता है, जब आप किसी चीज को खींचे, रबर को आप खींचे दोनों साइड में, तो वो स्ट्रेस में आ जाती है, साइज उसका बढ़ जाता है, स्ट्रेस में आ जाती है। तो सेम स्ट्रेस इज इन आवर डे टू डे एवरीडे एक्टिविटीज एज वेल। आप हमें समय बुला रहे हैं, राइट नाउ देयर इज स्ट्रेस। I have already committed to Sajid sir, and I got the instruction from university that there is a meeting at 5. For a few minutes I was under stress, but I cope up because I had a very good colleague of mine. I requested her to attend the meeting, and she attending the meeting. I am here, so I could resolve the stress without any symptom कि अब क्या करें, क्या ना करें, क्या करें, क्या ना करें, अब हम बेचैन घूम रहे हैं कि कॉन्फ्रेंस में जाएं या मीटिंग में जाएं, not like that. Coping stress of normal severity. Normal severity. अब now again a question कि हमें ब्लड प्रेशर तो मालूम है नॉर्मल क्या होता है, it is measurable 120/80, systolic 120, systolic 80. हमें शुगर लेवल मालूम है कि किसके बाद इंसुलिन लगनी है, किसके बाद इंसुलिन नहीं लगनी है। हमें वेट मालूम है, हाइट के हिसाब से कितना वेट होना चाहिए, मगर स्ट्रेस कितना नॉर्मल है, किस लेवल पर ये स्ट्रेस की नॉर्मलिटी खत्म हो जाती है, ये इंडिविजुअल टू इंडिविजुअल वेरी करता है। एक पायलट का स्ट्रेस टॉलरेंस, yesterday I was seeing a movie, not exactly movie, a video, when the pilot was stuck up in a turbulence, and how severe the turbulence was, and how could he maneuver and landed safely. His stress and the stress of other person, it's all vary from situation to situation, person to person. But coping with the stress is a definitely undefined, without putting a line of demarcation, is very important. But again, I will say that the severity of stress can also be measured. How? I will tell you. Severity of stress can be measured in 3 ways. One, it is causing your health, physical health. You are so much stressed that your blood pressure has shoot up. The blood pressure is not and the cause of stress, blood pressure is effect of stress, प्रभाव. और उससे मालूम होगा कि अगर मान लीजिए कि रोजाना का चीज है कि 2 केला रखा हुआ है, एक थोड़ा खराब लग रहा है, तो you have to decide that you have to take only one. You should go for this kela, that kela. It is also a conflict, but this conflict is unlikely to spoil your blood pressure. But if the stress situation leads to this place, that now right from the COVID, the saturation level is downing. I have tried 4-5 hospitals. No one is willing to take the patient because of either bed is not there or essential items, oxygen is not there. Where to take? There is one alternative which is unknown, and it is a life risk. Should I take to that place or should I not take to this place? Should I take this kela A or should I take this kela B? Or should I take to hospital A, should I take to hospital B? Are you finding the difference between the stress, severity of the stress, and causative factor of the stress? And this can be measured through your physiological changes. If it is of acute nature, and if this stress is the longer period, then it will be converting into your sleep disturbance, sleep cycles, your appetite, your biorhythms, your desire to interact with the people, and many other things. You become irritated, you become isolated, you don't feel like talking to your dear and near, you don't feel like talking to your own children, your own wife, you get upset very easily, only because you are stressed for quite some time, and there is no relief, there is no ventilation, there is no coming out. And the another work which I am talking about, the physiological changes and psychological changes, work productivity. You are being very, very competent with 0 errors, punctual, very obedient, having very good interpersonal relations in office and the workplace. But you are now a changed person. Everybody is saying कि इनको हो क्या गया यार, ये 4-5 दिन से इतना irritated क्यों रहते हैं? दूसरा कहता है काम टाइम से आते भी नहीं घर ऑफिस. तीसरा कहता है कि भाई 4-6 दिन से इनका काम बाकी है, ये काम भी नहीं कंप्लीट कर रहे हैं, सेम एरर किए जा रहे हैं. It means that your productivity has decreased, meaning thereby your stress level is increasing and it is beyond your coping mechanism. And the fourth is your responsibility towards community. अल्लाह ने, ये भगवान ने आपको सिर्फ इसलिए नहीं भेजा है कि आप अपना ये ज्यादा अपने बीवी बच्चों का ख्याल रखें. आपके ऊपर आपके पड़ोसी का भी उतना ही फर्ज है जितना कि आपके अपने घर वालों का. क्योंकि हमारा सर्वाइवल पॉसिबल ही नहीं है जब तक कि हम अपने कम्युनिटी के तरफ ना देखें. पॉसिबल ही नहीं है. When we took birth, it was community which gave us support for survival. अगर वो नर्स, वो दादी, वो नानी उस समय नहीं होती तो बच्चा सरवाइव नहीं कर सकता था, अनलेस कोई चमत्कार हो और भगवान किसी एक दैविक शक्ति को भेज दे. Otherwise, it requires very strong support while the child is taking birth. So we are makruz, we are qarzdar, we are in debt of society, and we have to pay back. All these educations, all this information which you are getting, you are not purchasing. It is free of cost. It is community which is giving you. So we are responsible for our community, and we have been doing something good for community. But if in case suddenly you are saying that I stopped taking interest in the community, I stopped taking interest in the community issues, I'm least concerned, least bothered that what has happened to, why the policy was weeping and why there was a chaos, why so many person is gathering into his house door, least bothered. अपने ही परेशान है, अपने ही में घिरे हुए हैं. So it means that I am slightly changing myself, maybe because the stress of any type is disturbing my coping mechanism, and the stress is higher side. Now, what is the relation between all these things, and how can I link with the COVID? Why COVID is so much known, so much talked about health issues. There have been so many diseases, still it is spread, it comes and goes. Nobody even know. How many person are worried about chikungunya? Are even now with about this disease which reduces the platelets count. I mean that mosquito bite. क्या कहलाता है उसको? Dengue. How many persons are worried about dengue now? Even at that time, except spraying the anti-mosquito and all these things and putting the full sleeve shirts and machadani. Nobody stopped coming out of the house. Machar kat lega. Nobody. Not in a single paisa economic was disturbed. No school was closed, but it was quite a dangerous disease. Road accidents are very, very common. Death caused by road accident is far, far more than the death caused by COVID even now, unfortunately. But we're still traveling. We're still going out. Nobody is concerned. Nobody is worried. Only thing, we take some precautions. Helmet लगा लिया, बेल्ट लगा दिया, स्पीड को कंट्रोल में रखा, बिना शराब पिए गाड़ी चलाया. That's all. Nothing more than that. But why COVID has, in spite of fact that still only 2 to 3% of population are inflicted, and out of all the population inflicted, only 1.30 are the fatal rate. So it is very nominal. Still, it is, thanks God, it is still very nominal. In my family, in your family, and your house, and all these things, there could be perceptible losses. My department is a very small department, AIBAS. Most unfortunately, 5 deaths start from faculty to the parents. So it is a rare circumstance. It is not the scenario. It is not a generalized figure which we can generalize. But still, 100% population are stressed and need mental health support in one way or the other. Why it is so? What is special in COVID? Why COVID is different from other illnesses? Any idea? The first thing is that it is unfamiliar, unexplored, unknown in all the aspects. In all the aspects, starting from pathology, genesis, ड्रग्स इसमें कौन सी काम करेगी, कौन से नहीं काम करेगी, पेशेंट ठीक होगा, नहीं ठीक होगा, कितने दिन में ठीक होगा, क्या इसका अल्टीमेट फेट होगा. There is no concrete information because the onset of this was very abrupt. Nobody knew before. It was highly unpredictable situations. All these 3-4 drugs which has been tried, even the latest drugs, injection, remdesivir, which has been in the market, and most unfortunately, most unethically, criminal behavior has been attached to this, that people have sold these drugs of 3,000 rupees to, in Lucknow market, 20,000 rupees, and in Delhi market, 50,000-60,000 rupees, one injection, and 5 injection courses there. Even that drugs has come under serious controversy. I do not know how long and how far this research finding is correct. It is reported that there had been lot of substandard drugs also. I'm not quoting this officially, but I've been sharing with this information. You might have seen it. The ampoule which has only salt and glucose powder, and the ampoule which claimed to be a medicine, the outcome of the medicine was reverse. There were serious reactions of these drugs where it was given genuine drugs, so-called, and there was no side effect, and the improvement rate was slightly better than where it was only injected salt and sugar, glucose. God knows how far this study is correct, but this is the report which has become quite point of discussion. This blood therapy, when that you have to take blood and refine it and only inject part of it, not full blood, it is a serious controversial therapy. And perhaps recently WHO has discarded that therapy from the treatment protocol of the COVID. कहने का मतलब यह है कि कौन सी ड्रग्स इसमें काम करेगी, कौन सी ड्रग्स नहीं काम करेगी, जो हम ड्रग्स दे रहे हैं ये इफेक्टिव है, नॉन इफेक्टिव है, ये अपने आप में हाईली स्ट्रेसफुल है. दैट इज व्हाई कोविड इज स्लाइटली डिफरेंट. The next thing is that it is a pandemic. Pandemic means that it is covering the very, very vast area. It has covered entire world, and it has no season. It doesn't know any season. डेंगू के लिए ये फैक्ट है, रिसर्च है कि जब टेम्परेचर चेंज होता है, ट्रांजिट पीरियड में ये मच्छर डेवलप होते हैं. इट वाज सो फास्ट विद मलेरिया. ट्रांजिट पीरियड में ये डेवलप होता है, फिर जैसे ही गर्मी बहुत ज्यादा बढ़ जाती है या बहुत ज्यादा ठंडक बढ़ जाती है, बिकॉज ऑफ द मॉस्किटो कैन नॉट सर्वाइव इन द एक्सट्रीम टेम्परेचर, it will reduce by itself. It will go for the extinction. May come the next year, that is separate thing, but at least for quite long time there is. But for this COVID, it has not at all a season-based issues. And in spite of all the efforts made by public, government, individual, NGOs, it is spreading and it is becoming worst. So-called the first phase was better than the second phase. The severity of symptom of second phase had been reported to be still worst. The side effect, after effect, COVID is only mehman of 10 to 12 days. Virus, coronavirus, is mehman of 10 to 12 days. It will go by its own way. But the impact which it leaves, it may be with you for 2-3 months, which was not experienced during the first phase. So it is, and it is absolutely uncertain where, when, to whom. Till yesterday, you were absolutely all right. For no obvious reasons, for no perceptible channel, you got infected. And your entire planning for the entire months, your academic planning, your career planning, your personal planning, your social planning, शादी ब्याह सब fix हो गया, कार्ड बढ़ चुके हैं, and with no sudden, with no prior, if a person is diabetic, one can make it out that after, if he is not treated himself, his fate is quite clear. If the person has hypertension, if he is not treating himself, if the patient is even the cancer malignancy is there, you can make it out that what would be the ultimate fate. But no, अच्छा खासा हंसता खेलता बोलता आदमी, suddenly he develops fever and he gets symptoms. So this uncertainty is a symptom for a varying from mild to moderate and moderate to severe. And the living conditions starting from change of your attires to your isolation, your distance from your own loved one is very stressful. You are taking the patient to the hospital, and thereafter what is happening with him, you are not aware of it, except one phone call in 24 hours. How he is passing, who is interacting, who is dealing, whether he is comfortable, whether he is not comfortable, what are these issues. In no other disease, no matter the patient is on the ventilator or in ICU or in a ward, a guardian, a caretaker is allowed to interact. And this isolation is very, very seriously killing. It develops a sense of dejection and isolation among patient and helplessness among the caregivers. Social and economical changes. Yesterday I was seeing, though it is quite हंसने वाला एक पोस्टर था कि एक किसी ने डाला है, व्हाट्सएप आपने भी देखा होगा कि बहुत दिन से ये पढ़ने में नहीं आया कि रात्रि भोज 8 बजे से आपके आगमन तक। अक्सर हमारे यहाँ कल्चर में जो शादी कार्ड वाला होता है उसमें टाइम डाल देते हैं कि इतने बजे से इतने बजे तक, या एक नया ट्रेंड है कि 7 बजे से आपके आगमन तक। एक जमाना हुआ ये पढ़ने में नहीं आया। You can laugh at this, but this is the fact. Living in the same city, not participating in any of the program, you may afford to not participation in Shadi Biyah and other things, but even in death, only 1 or 2 persons carrying the coffin, the janaza, the arthi, and पूरा शहर आपके रिश्तेदारों से भरा हुआ है. You can visualize the helplessness for both, the one who cannot go and the one who is managing alone, all alone. I do not know whether the precautions taken is magnified or it is required, but it is in practice. It is in practice, and nobody can dare to break the practice, because what will be the fate of the person who is zinda? जो मर गया बेचारा मर गया, जो जिंदा उसको तू केयर कर भाई. So ये जो मैसेज है, ये एक फर्दर चैलेंज इंड्यूस कर रहा है. Totally financial uncertainty. 2 साल हो गया, 1 साल हो गया, किसी भी सीजन में seasonal sale of the small shopkeepers, whether that is Diwali, whether that is Holi, whether it is Eid, साल भर की कमाई इसमें होती है. But most unfortunately, the small vendors, even the big industrialists I have seen, I have interacted, is totally uncertain. They have invested lakhs and lakhs of rupees. See the traveling agencies. They purchased new vehicles in 19 for New Year's Eve and for enjoying and for the traveling seasons. Number of hotels has been closed down, and so many things. No other disease, no other condition has led to this situation. So these are the conditions which made the COVID a very different and a challenge for everyone, particularly the caregivers, particularly the family members, particularly the professionals and the patient himself. But having said so, what has to be done? What is your role एज ए साइकोलॉजिस्ट, या कोई भी पब्लिक अगर उसको ऐसा महसूस होता है तो वो क्या करें, किसके पास जाए, और साइकोलॉजिस्ट का क्या रोल है इसमें? क्योंकि हमारे पास अभी जो स्टूडेंट्स बैठे हुए हैं वो डिफरेंट डिसिप्लिन के हैं, एंड बट ये जो सेंटर जो है ये मेंटल हेल्थ तो प्रोमोटर है, तो क्या करना चाहिए ऐसे उसमें? फर्स्ट ऑफ ऑल, दैट इन एवरी कंडीशंस there should be a very, very intensive and detailed assessment. Assessment not in terms of the symptoms, that everybody will see that ये 4 दिन से सोया नहीं है, ये irritated है, ये depression है, इसका anxiety scale पर इसका ये score है, depression score ये score, वो that is not the assessment. Assessment of the resources available with him to cope up, which you during your counseling sessions you can expedite, you can exploit. How much life, psychological life is still available which you can give. ऑक्सीजन जो दिया जाता है वो बचे कुचे लंग्स के स्ट्रेंथ को इम्प्रूव करने के लिए और उसको सरवाइव कराने के लिए, साथ साथ उसकी ट्रेनिंग भी दी जाती है, साथ साथ उसकी फिजियोथेरेपी भी कराई जाती है कि हम ऑक्सीजन सपोर्ट कर रहे हैं, आप फिजियोथेरेपी कीजिए, अपने लंग्स को स्ट्रेंथन कीजिए, ताकि आप शुरू में हम आपको सांस देंगे, फिर आप खुद अपने सांस लेने लगे. So assessment of resources available with the person, assessment of his residual capacity, psychological residual capacity. He is burnt out. Nobody can say that he is not burnt out. He is burnt out. आपने देखा होगा HRCT जो होता है, चेस्ट का जो एक्सरे होता है, वो 25 पॉइंट्स होते हैं उसमें, यानी जो लंग्स का जो चैम्बर्स है उसको 25 हिस्सों में बांटा जाता है, और उस सीटी स्कैन से देखा जाता है कि कितने हिस्से इन्वॉल्व हैं, और जो इन्वॉल्व है उसके ऊपर आदमी नहीं रोता है, जो बच गए हैं उसको यूटिलाइज करता है. तो व्हाट आर द एलिमेंट्स, व्हाट आर द होप्स, व्हाट आर द थिंग्स आर लेफ्ट आउट in the individual psychologically, that has to be assessed. What are the motivation, what are the resilience? We have a scale of resilience. I think next speaker would have done some work on this while she was working in the AIBAS, resilience to overcome kiya unhone. So we have to assess the resilience power. Why? Resilience is the capacity, as the immunity is the weakest blood and all these things to assess the immunity and infections. Resilience is the capacity to fight back, to combat and come forward, come again with a more stronger psychologically. So resilience can be promoted, resilience can be improved by counseling and by sessions and all these things. So assessment for that point of view. Assessment, how much you can transform his negative approach to positive approach. How much he can perceive positivity into negativity into the positivity. One thing very peculiar, when we talk about COVID, we hate talking about the positive with COVID. But when we talk about the management of COVID, we look forward to have a positivity, psychological positivity. He is psychologically positive. So he can convert his negative thoughts, negative perception, attitude, something by his own way and something induced by the media and irresponsible journalism. That every day you will find a series of pictures and informations of dead. Hardly there is, I had to search practically every day that today how many person has recovered, whether it is WhatsApp messages or it is Facebook messages or even the newspaper being supplied to the hospital in the private ward. I was in the private ward. The first heading used to be very, very devastating with the photograph. A dead body is floating in Ganga and the dead body is lying on the Balu and all this thing. I've seen that photograph while I was in the hospital. I used to laugh because I had that much maturity, and thanks God, God has blessed me not to have very, very severe symptoms. So I was quite hopeful of my survival. So, but I was just thinking that the one who is not so blessed, and the paper is going to them also. Then I requested the owner of the hospital to discontinue this paper, and she heard me, and she discontinued the paper. The second thing is psychological psychoeducation, which is very important. Many of our confusion, many of the stress is because of wrong information, because of wrong false informations. And we have to modify our information. If you simply give the correct information, you will realize that the patient is anxiety level has reduced like anything. We are anxious because we either do not have information or we deny reading the information. If something is matching to my condition, we'll just change the page, we'll not read it out of fear, out of anxiety, and out of the thing. So denial will not help you out. You have to listen, you have to collect the correct information, and that is a very important role for clinical psychologists to handle these things. Psychological first aid. You have to give the psychological first aid, and in that hope and possibilities of survival, and hope and possibilities, hope and expectations. I'm seeing that time is running very fast, so I'll just finish within another 2-3 minutes time. Thereafter, systematic support, starting from intensive psychotherapy to cognitive therapy, mindfulness, gratitude therapy, and a series of psychotherapies which patients should get simultaneously, side by side. In the hospital where I was, beside the injections and all these things, they used to give me a series of 32 पुड़िया देते थे सुबह से शाम तक. आयुर्वेदिक पुड़िया होती थी, उसमें ये भी होता था, अदरक का चूर्ण भी होता था, और आंवला पाउडर भी होता था, और अजवाइन भी होती थी, और मंगरेला भी होता था, दालचीनी भी होती थी, हल्दी पाउडर भी होता था, एज ए सप्लीमेंट to support my immunity. So simultaneously, you have to associate yourself, you have to link yourself with the mainstream treatment, and you will see that the patient is improving because psychological support has proved beyond doubt in improving even the severe patients of any physical disease. And at the end, it is interdisciplinary. You have to have faith and support from all the corners. I think you are all aware, I'll just share with you sunflower phenomena. I think once I presented this. What is sunflower phenomena? जब सूरजमुखी का पेड़ दिन भर तो सूरज से वो अपने लाइट लेता है, एनर्जी लेता है और काम करता है. जब शाम को अंधेरा होने लगता है, चारों तरफ से कुछ नहीं समझ में आता, तो एक पेड़ दूसरे पेड़ की तरफ चेहरा करके खड़ा हो जाता है. वैसे तो दिन भर सूरज की तरफ रहते हैं, बस ग्रेजुअली शाम को जब अंधेरा होता है तो एक दूसरे फेस टू फेस हो जाते हैं, and they get energy from within, from each other. I think this is a time to behave, to become the sunflower and give energy to your friends and to your relatives and all these things. With these words, I think whatever time I have shoot up my time, it was limited. Thank you very much.
Thank you so much, sir. अपना पर्सनल और प्रोफेशनल एक्सपीरियंस हमारे साथ, हमारे ऑडियंस के साथ शेयर करने के लिए. एंड लास्ट में जो आपने सनफ्लावर फेनोमेना का एग्जाम्पल दिया वो शायद हम सब के लिए एक बहुत अच्छा एग्जाम्पल है जो हम सबको आज से ही अभी से ही शुरू कर देना चाहिए. थैंक यू सो मच सर. Moving forward, I would like to invite our invited speaker, Dr. Sneha Saha ma'am. Good evening, ma'am. Dr. Sneha Saha is an assistant professor with the Department of Psychology, Christ, Delhi NCR. With over 8 years of experience, her doctoral study was based on the capacities of positive youth development intervention on adolescents. She is an awarded gold medalist for a Master's of Psychology degree and Research Methodology course. Her scale publication of national reputed name, the Cinderella Complex, complex scale, a measurement for women dependency syndrome, is already being used by many young researchers and showing extraordinary relevance to the community. She is a published researcher with a book chapters, and Scopus publication to her credit. She is a certified clinical hypnotherapist by Eka Foundation, Mumbai. Currently, she is working in collaboration with multiple national and international colleagues on researches in environmental psychology, media psychology, and organization psychology. We are enlightened to have you as our speaker, ma'am. Over to you, ma'am.
Thank you, Divya, for that warm introduction. Can I please get the rights to share my screen?
Yes, ma'am.
And one more introduction, that I am honored to be a colleague of her. I've worked with her for some time.
Thank you, sir, and same this way. You have been a very true leader for all of us, sir. Thank you for having me.
And sorry, I've taken some of your time.
It's okay, sir. It's okay, sir. It's always a pleasure to hear you.
Thank you.
Ma'am, now can you share the screen?
I'll just check. Yeah, got it. Thank you.
Well,
just let me know once that the screen is visible to you. PPT is visible?
yes, ma'am. Yes, ma'am. It's visible.
I would like to take this opportunity first to thank Indian Mental Health and Research Center to have a series of webinar that is a very need of the hour at this point of time when we are all going through the pandemic. We started with the year 2021 thinking that, okay, COVID-19 is like a history. But then again, the second wave came in with very bad experiences for almost all of us. And we thought that, okay, maybe COVID-19 is not a past. Maybe it is going to be our future for a little bit of time. And Zaidi sir in his keynote has specifically enlightened us about what COVID-19 has been in all of our lives. So I'm sure all of us relate to his experiences, and all of us have got our own experiences related to COVID-19, which has made us a little more stronger psychologically. And it is just helping us to cope through day by day. As of now, the next day is like a question mark. We are not able to make our plans. Future plans are not happening. We are not able to come up with vacations, like the smallest of things. Vacations are not happening, and people are thinking, where is our life going? Specifically talking about the work and life balance that I'll be focusing on. So yes, it's a very dire time, but all of us together can cope through, one step at a time, baby steps. And I would like to reinforce what Sir said in his keynote, that at any point of time, we are professionals, we are survivors, and we are caregivers. Keeping that in mind, I would like to start my session, and I'll take a different take on COVID-19. It will specifically focus on work-life balance. And when I say work-life balance, it is something which all of us are going through. So whether you are a student, where you are handling your parents and your classes all together, or if you're a professional handling your bosses, your work, and your family members, or whether you're a person who is looking to get into the job force, even then you have to strike a balance between your life, your preferred way of life, and the work life that you're ideally looking for. Amid COVID-19, the topic itself changes a little bit of meaning, because it not only focuses on work-life balance, it starts to focus on home work-life balance. So the word work-life balance itself has, changed its definition through centuries. It was first introduced in 1980s, but I'm sure the entire paradigm of work-life balance has changed. Um, I think 2 years ago we were just talking about how men should be empowered and they should be given paternal breaks as well. That was the concept of work-life balance then, and how women should be given equity when it comes to payment 2 years ago. But within these 2 years, we have learned that the term work life balance has got a little more deeper meaning to it. Specifically, when during COVID-19, our home spaces have become our workspaces. And all the tension and um, struggles that we had in our work in an office setup, all of those struggles are happening in a home environment now. So our parents are looking at how we are dealing with our jobs. Our children are looking at us. They are observing, they are learning new things each day. And our family members are there supporting us all the way through. So how do we create a work-life balance when our home and work don't have any specific boundaries now? COVID-19, again, I would like to reinforce, for a few years in the future, we are maybe looking at practices where we have to include COVID-19 as a part of our work-life balance. I'm sure it will soon be a past, but for now, we have to understand how to get on ahead with our life, how to understand ourselves as a professional, as a survivor, and as a caregiver. Moving on with the slides, I will try and induce a little bit of laughter into the session, because that is what we would like, resilience, as sir was saying, that we have to bounce back no matter what. So it need not be always a serious take on whatever I'm going to speak. So maybe a few loads of laughter would be good when I talk about the session. So this chap is how we are actually right now. This is our life. So again, starting with professionals, students, students who are looking to be professionals, like in the next set of year, we are all buzzed with the work that is happening, specifically at home, where there is no specific boundary to this is home and this is work. As of now, maybe just a room setup is what your office is, and as soon as you step out of the room, you change roles. For example, I am in this room as an assistant professor of psychology. As soon as I stepped out of this room, I will become a wife, I will become a sister-in-law. If I get on a call with my parents, I'll become a daughter, a sister. So I keep on changing roles, but the situation that is around me has somewhat blurred out. Yes, there is a lot of work pressure that we are under. There is a lot of um, breaks that we are keep on expecting, but it does not happen. Many students are quarantined with the kids, and for them, they are continuously changing roles between being a professional and then being a teacher as well for the students. I have had personal colleagues who in one room are taking the class, and then within next hour they are also looking into their children and their assignments, whether is it happening or not. So how can we cope with a work life balance when our entire work and life has shifted into these four quadrants of the house? uh, I'll quote Michelle Obama here. She said, we need to do a better job of putting ourselves higher on our own list. Many a times it is seen because organizations pay us and we feel like that we are indebted to them. If they are paying us, we should work for them. This becomes our mindset. I think almost all of us have got this mindset. We never feel like, okay, we are getting paid, but maybe we can think about ourselves as well. So the first image, if you see here, it's like way into the future when people will look at their lives. A lot of people deliberate and think that, okay, my life was all about work, work, work. I did not get time to explore my interests, my like. I was not able to travel. Now that I am of this age, I am not able to physically enjoy the life I would have as I would have been a young person. So rather than putting work ahead, we need to prioritize ourselves. We need to think that, okay, this is the time where I have to balance it out. It need not be only one way looking forward to, where you're only looking at the work culture and not towards the home life or life in general. I will keep on quoting some stats along the way to help you recognize the paucity of the topic even more. So this is one research that people have said, the research have found out that when work happens, almost 74% of the work you complete during your normal working hours, but you still take 26% of your work at home, which happens during the night. I myself as a teacher always motivate my students to complete their work in a given set of time. Do not exceed their time, let's say after 7 p.m. Do not work for your assignments or uh, focus on yourself after 7 when the classes are done. Relax. I've always said that. But then I am the one who has always been seeing that I'm getting emails at the night as well with the assignments. Not only students, as professionals also, many a times we feel like 24 hours are not enough. It is not enough to give 100% to the job and then have a family life. So most of the time, maybe at nights also, we are discussing something with the family members, but then work is coming up. So with the pandemic and then with the work from home culture, it has given a rise to 24/7 always on work culture, which is where our work-life balance comes in. We need to understand that we cannot work 24/7. It cannot be 24/7 work, work, work. We need to switch it down. We need to take a step back. We need to reflect a little more about it. And we do not want burnout to happen. We do not want overworking to happen. Both burnout and overwork will result in job dissatisfaction. Additionally, it will result in not having a happy family life. So with the rise of the pandemic and the rise of 24/7 work culture, we need to take a step back and reflect on how we are going with our life. Now, this is a data that has come in the pandemic time, and it is about how Indian millennials split on work from home culture that is happening. I would like to take your attention into a few of the points. So work from home has increased office workload. I will vouch for that. No matter how much work you have, since the time we have introduced work from home and we are taking classes from home, or for example, my husband is doing his office work from home, office workload has comparatively increased, mainly because of the 24/7 work culture that we have introduced in our lives. Then during work from home, many people are disturbed by the family members, and it becomes a little bit annoying because they are not able to perform better on those terms. Working without colleagues have become very unsatisfactory when it comes to work from home culture. So because work from home, for example, right now I'm sitting in a room with a system in front of me, although I know there are 100 of you out there listening to me right now, but I am still here alone in the room, looking into my PPT and speaking certain things. So this being alone factor has had a lot of psychological impact on the workers of any class, and they have said that it is very unsatisfactory to work without colleagues. With colleagues, you get time to take a pause, you get time to have a little laughter in the room, you get time to think about what all things have to be done. But without colleagues, it's a matter of you, your laptop, and your work. So these are certain important parameters that we should try and reflect on when we are trying to find a balance between work and life. On those terms, this particular quote right here, you can't truly be considered successful in your business life if your home life is in shambles. So one cannot always expect that if you are very good at your work, if you are giving 24 hours a day, 7 days a week, to your work, you are successful. Your success is also dependent on how your family life is, uh, and how much smiles you have in your life, how much laughters do you have or you share with your family members. And additionally, what are you giving back to your community? So this is how what the modern life looks like. So all of you can imagine yourself in this particular caricature, sitting on a laptop entire day. That is your work, that is your home, that is your play. And many a times when you're sleeping, you are thinking, oh my God, this work is still there. I remember a lot of students coming up to me and saying that, Mom, I'm not able to get sleep because I keep on thinking that these assignments are due, or these set of works are still due. Similarly, for my colleagues as well, when we are trying to sleep and we are going through the entire day, that what kind of day we had, there are a few misses that we have, that okay, this should have been done, this should be done. So that becomes our next day priority list. Um, although we don't want our life to be like this, but our modern life has become like that. So it is all about how much priority are you setting to your life when it comes to your work and your life. In the next few slides, I'll take you with some tips and tricks that you can use in your personal life when it comes to find a work-life balance. So yeah, let's take a trip. So whether you are a professional or a student, I think the next few slides is going to help you out to understand how to strike that balance. For each one of us, the balance will be different. The priorities will be different, but maybe the tips that I have for you can be used in your personal lives. This is just a fun take on what working from home actually is for a lot of people around us. So what society thinks that a person does when they're working from home is that they're sleeping. What your family might be thinking is maybe you're enjoying your life, seeing a movie. What your friends might be thinking is, okay, they're seriously working on something. What your clients might think is you are on vacation because it's working from home. What you might think is, I am working a lot. I am giving my 100% to the job. But what you actually end up doing is getting frustrated because that work-life balance somehow is a miss. And the stress of completing the entire work and then giving appropriate amount of time to your family members as well. So that is how we end up looking like, if not physically, but inside our head, we are still those people who are screeching around that, okay, I need to get a grip on myself. I need to have a life where I'm able to balance it out. So I'll quote Dolly Parton here: never get so busy making a life that you forget to make a life. It's a very beautiful quote, and I find that it is very fitting because at this point of time, even though it is pandemic, and we have all had our stories of the pandemic, we are still very busy making a living for us. And maybe we are forgetting how to make a life of our own. So when I say life, it is all about positivity. It is about your likes and dislikes. It is about your interests, your memories, and your autonomy altogether. And when I'm saying making making a living, that you're busy making a living, we are also maybe salary, or you're getting your financial aid from, because many of us literally are indebted to our organizations, that we are getting paid for it, so we have to give 100% to it. So we forget that money is not everything. At this point of time, I will uh, share a personal anecdote. So this is again related to COVID-19. All right. So this was one day, I think this person had a birthday coming up, and that particular day, the birthday day, this person was not feeling well and they had recently tested positive for COVID. So there is a lot of birthdays and anniversaries out there which has gotten spoiled because of COVID-19. They were not able to enjoy. But what is the takeaway from that particular one moment is that if you don't have your health, if you don't have your mental resilience, all the money in the world cannot help you have a good life. You may think at one point of time that money is everything and I need to work for myself, I need to work for my family, how will I provide for them? All of these are very valid uh, concerns, I understand. But equally valid is, how are you making a good life? Children won't remember how much money you made, they would remember how much smiles and memories you all made together. You will also, when you reflect back on your life, you would always want to remember moments where you did something for yourself, for your family, for your community, all of those things. So we should never forget to make a life. Making a living is very important, yes, but never ever forget to make a life. uh, Now I understand there are a lot of professionals here. Maybe some of you are from psychology field, some of you are from a different field, maybe doctors, engineers, I don't know. And as I said before, all of us are very different people. Our priorities are different. So there are people who have got big, huge families to take care of. There are people who are happy being just husband and wife. There are people who are living a single life, but still they have got their parents to take care of. There are a lot of parameters out there where a lot of different kinds of people out there, and each of you have got a unique story. So when it comes to you as a unique person, and when I talk about maintaining work-life balance, not the same thing will be applicable for all of you. Again, maybe some tips and tricks could, just click and you feel like, okay, I can use this. But it depends 100% on your office and uh, life goals, whatever you have. It depends on who do you want to be as a person, and how are you going to get to be that person. So it's very important to have a specific goal in your mind when you're trying to aim for work and life balance. A little bit of theory, but not that in depth for you all. When I'm talking about work life balance, I am trying to focus on your well being and your control. So, your well being is what Sir was also talking about: physical, mental, and social well being. It is very important for your work life balance, because if you are physically doing well, if you are mentally happy, if you're mentally healthy, and your social well being, your family members, your community is happy with you, that would directly result into a very happy life. Additionally, boundary control is about how are you getting to control over your work system and your life altogether. So how much of decision making is going on, how much of attention do both of these structures need for you, that is important. So always, all the people say, and I almost all the anecdotes that I have right now with me, they always focus on life more, rather work life more in work and life. So it is always very essential for you to have a perspective of your life altogether. How are you feeling physically, how strengthening mental processes you have, and how good your social relationships are, how well are you placed in a community, and how well are you able to give back to the community. All of those things are very good indicators of your work life balance. Now this is when I say work life balance, it's a cyclical procedure. So it's not an achievement. I cannot say that I have work life balance. It will always differ from day to day. For each one of you also, one day you may feel like that, okay, this was a very good day, I was able to wrap up my work in a very precise manner, and then I had time to spend with my family members. Or maybe some Sunday you feel like that, okay, I have to work on a Sunday also, I don't feel like working on Sunday. So your work life balance is like a cyclical position, structure which always keeps on changing. You can never say that. It's not like nirvana, that I have achieved it. No, it is not like that. It is something where you have to think about it multiple times. You have to understand about it. You have to introspect, and you have to make sense of what is happening in your life. On those lines, again, it's just a basic structure. Maybe you can um, implement this in your life. The first step that you should take while thinking about um, work life balance is to take a pause and denormalize. As of now, as a general consensus, we are all just rushing with our life. We are not pausing. We are not thinking, what if? We are not thinking, I want to do this. It's like a daily work that is going on and on. You get up in the morning, you get ready for your office work, you complete the office work, then there is lunch going on, breakfast going on, dinner, family time. Everything is happening in a very, one-to-one manner that, okay, this has to happen. But at this point of time, whenever you feel like that I am reaching a state of burnout, whenever you feel like it is getting too overwhelming for me, take a pause, denormalize. Denormalize meaning, for us it has become normal to get up in the morning in your home itself, work in your home, have your family life in your home, and then go back to sleep, then again next morning repeat. You need to remove that normal. You need to change your normalization. Second, you need to pay attention to your emotions. How many of you feel agitated some days? You don't know what is the reason behind it, but you feel like that, okay, I'm not doing something, or there is something that is at the back of the hand, back of your head. It is like still working on that. I need to do this. I need to do this. You're not able to pause yourself altogether. And that directly relates on to your emotions as well. So you become very angry, you become very moody, and all of that translates into your family life as well. So the way you talk to your family members, the way you talk to your office colleagues, all of that becomes based on your emotions. So you need to pay attention to your emotions at any point of time. If you're feeling that your emotions are getting the most out of you, if you feel like that, um, okay, I am getting very irritated, you need to stop. You need to understand what is the reason behind it. See, earlier 2 years ago, when we were having different work setup, life setup, it was easier for us to understand why are we getting irritated. Because if we are irritated at work, then it is something related to work. If we are irritated at life, in your home structure, then it is something related to life. Now, when the line has blurred up altogether because of the pandemic, and we are all connected on to the system almost all the time, it becomes difficult to understand where your emotions are coming from. You need to pay attention what went wrong. Even micro things sometimes can be a trigger for your stress. So understand. Third thing that you can do is you should reprioritize. Reprioritize meaning, maybe at one point of time you feel like, okay, work is something that I have to take care of. But then, as I said, work-life balance changes daily. Maybe some days your family needs you more. Again, I'll take an anecdote from the life. Uh, Recently, even my family contracted with COVID-19, and the entire prioritization switched to our health, our physical health, our life altogether. And we were very lucky to have very supportive organizations backing us, where we were able to reprioritize everything. So for that 1 week, 2 weeks of time, our priority lied only with our physical health and our mental health within the life structure. We did not worry about our work structure. So you need to understand when you have to reprioritize. I have seen many people who would go to work even if they're not feeling well. Maybe me included also. Before the COVID time, I would never have missed a work day in my life. But yes, we need to reprioritize. We need to understand when which priority is uh, required to take an upper hand. Then additionally, consider your alternatives. There are always alternatives. Okay, it is not that some things only depend on you always, or if you are not there, then things won't happen. Or if in your life, if you're talking about, then if I am not able to get this thing done, then my life is finished, or I should not be able to go ahead into certain things. For example, you're working on a project and you feel like that, okay, this is the deadline of the project, I can work on it. But then as soon as the deadline is nearing on it, you feel like that, okay, maybe I'm not completely in control of the project. What do I do now? And it starts to give you stress. You start to think that how to go about it. you should always have your alternatives ready. I tell this to my students also. You should always have a backup plan with your plan. Not that you're sending out an intention thinking that um, something bad will happen with your plan A, not like that, but always have your alternatives ready. Having your alternatives ready helps you to normalize the stress that your plans or your planning can have. Okay. Majorly because when you are giving your energy into certain things, you feel like that this should flourish, this should not fail. But what if there is 1% chance that something is going to happen? You should always have your alternatives and you should be ready to consider your alternatives. And then implementing change, whatever changes you want in your life, whether small, whether big, it should be something that you should uh, implement in your life when we're talking about work life balance. Now, this is specifically in terms of stabilizing your mental, physical, and social well being. Additionally to that, gaining more and more control over your day to day decision making. So, whether it is related to your life, whether it is related to your work, you get more and more control over it. And then you're equally taking care of your personal self. So that is where your implementation on change should come in. One of the biggest implementation of changes that happens when we start to strike a balance between work and life is taking care of our physical self. So many people let go of their physical health thinking that this may not be a priority at this point of time. Maybe we can think about it a little later. We'll focus on other things, office, family life, and all of those things. But it is very essential to have a good physically healthy life altogether. So you can start with just walking, 10 minutes of walking, 15 minutes of walking, it does wonders for you. Having a good diet, that does wonders for you. All of those changes are required to strike a good balance between work and life. What are the key takeaways that you can have? The first one is intentional mantra. So intentional mantra, I would like to indicate is like these are your guiding principle. Now, for each one of you, your mantras will be different. So it is your principles about how can you increase your work productivity, how can you have a better connection with your family members, and how mindful you are of all of your behaviors. So for example, one of my mantras is that whenever I am doing a work, it has to be in a manner which is giving all kinds of productivity. So it is not only related to the work that I am doing, it has to be productive when it comes to my personal front and when it comes to my professional front. That is my intentionality. And the second one would be that I should be able to switch between who I am as a professional and who I am as a person altogether. So my personal life and professional life, I should have a slight boundary between the two. Apart from that, having flexible social rituals are also very important. So social rituals is that all through the day you are taking small breaks. uh, Now, ergonomically speaking, many of us prefer that if we are taking a lecture or maybe attending a class, that we are sitting there for that 1 hour of time. Even now, right now, I don't know, we have been in session for 1.5 hour. For 1.5 hour, all of you are sitting at that one place. Ergonomically, it will be difficult for you to, uh, rather than difficult, it will be physically draining for you, right? So it is always important to take very short breaks when you are working, whether working or you're enjoying a family life. Take small breaks throughout the day. Those breaks help you break the monotony of your work life. It helps you catch up with your family members, your friends, maybe over the call, and it helps you physically to let go of the screen for a little bit of time. At this point of time, the screen time has increased and it has resulted in into a lot of problems when it comes to fatigueness or your eye problem. All of those things are happening, so it's better to take short breaks. uh, In human ergonomics, it is said to take 20-20-20. So that would mean that 20 minutes you look into the screen, after 20 minutes, you get up, you walk for 20 minutes, and then you come back and sit down again. It's a very good ritual. If you can follow, it will be great. And then the final takeaway should be that all of you should have a shutdown ritual. So shutdown ritual is where you are telling your brain that this is the end of the day from your work setup. So for many of you, maybe shutting down your computer becomes that indication that, okay, I'm done with the job. This is it. Whether it is 8 at night, 9 at night, you feel like that this shutdown is complete and there is no work remaining. If you have these specific actions, your family members are able to see that, okay, work is done. You yourself can relax that my work is done, my system is off now. And then you can start having or enjoying your quiet time. That will be your family time altogether. We are nearing the end of the session from my end. This is where I would like you all to leave at. Again, these are the takeaways that you have to implement in your life, in your sense. Pointers may be common, but for each one of your life, because it is very unique, you will have to understand how to strike a balance. So I think this image itself will help you out. So when you're very busy, that is your office work. When you're very quiet, that is your personal work. You have to strike a balance between somewhere in the Venn diagram, to strike a balance where you can understand that, okay, this is my space and I have understood where my work is, where my life is, and I can strike a balance between the two. I would like to end with the quote saying, once you accept your perpetual state of confusion, everything else gets a lot clearer. So it's again one thought that I am leaving you all with. At this point of time, many people may feel like that there's a lot of confusion, how to take care of yourself, of your family. So if you're a survivor, how are you getting back onto the field? If you're a caregiver, how are you taking care of your family members? If you're a professional, how to take care of the job work? There is a lot of confusion that is happening. And again, with, as Zaidi said, the news out there, the infodemic that is going on, it is very much easier to get a very clearer perspective on anything which is confusing you at this point of time. If you get a clearer perspective, it helps you to imbibe that into your own life setup, whether your personal life or your professional life. So once you accept that, okay, there is this confusion, I need to have it cleared out, it helps you to understand yourself as a person. It helps you to take care of yourself as an individual. And then again, when I'm talking about your individuality, I'm also including you, your family life, your responsibility as a community, a person, and then you as a professional as well. Somewhere between experiences of having a good professional front and having a good personal front, we need to understand where to strike that balance. And it will only be helpful for us to understand the balance when we are able to pause, reflect, and implement the changes. Without that, without thinking about ourselves, without thinking about our priorities, it will be very difficult to understand the balance point of work and life. And then again, pandemic is not here to stay, it will go away. But for now, for us to be resilient in our workspace and our home environment, we need to strike a balance between work and life. Thank you all. That will be all from my side. Take care. Signing off. I'll stop the screens here now.
Thank you so much, ma'am, for enlightening us about how we can maintain work-life balance. बहुत जरूरी है. We all are learning. अभी हम सबके लिए work from home culture बहुत new है. So we all are learning that how to maintain this work-life balance, and definitely I'm sure that all the participants who are listening to you might have taken the note of the tips which you have just shared with us. Thank you so much, ma'am. आगे बढ़ते हुए मैं टीम IMHRC को इनवाइट करना चाहूंगी आगे की प्रेजेंटेशंस के लिए. Over to you, team. आगे हमारे कुछ टीम मेंबर्स कुछ प्रेजेंटेशन करेंगे कुछ स्पेसिफिक टॉपिक पे रेलेवेंट टू COVID-19 एंड
Hello everyone, is my screen visible?
Yes, Beauty, it's visible. Okay, so just a quick mic check. Am I audible?
Yes, you are audible and you are visible as well. Thank you.
So indeed, a lovely evening it is, and we are extremely delighted by your presence. So now I, Divija Kaval Soin, along with my two other mates, Diksha Verma and Ayush Rana, will take ahead this webinar from here. But before I begin, I would really like to extend a token of gratitude to all our supervisors at Indian Mental Health and Research Center for giving us this great opportunity to enlighten you all on this topic of maintaining work-life balance amid COVID-19. We do understand that patient listening is quite a tedious task, but please bear with us till the end. And also we are aware of the fact that is platform pay we are connected with people from different states and cities all around. So we are going to try to sound as easy as possible so that we're all on the same track. We want to keep this interactive and just ensure you have some good key takeaways in the end of this webinar. Moving ahead, keeping in mind what Sneha ma'am has already discussed with us, I think this is an excellent quote to begin with. While we were researching, we found this statement by Stephen Covey that says, the key is not to prioritize what's on your schedule, but to schedule your priorities. So the question is, do we actually agree on this statement or not? Can we relate to this somehow? So please, let's just not keep this one way. Maybe we can just, share our views in the chat box. We really request you all to respond. Maybe a quick yeses would be fine in the chat box. So yes, we have started receiving yes. Most of you seem to agree on this statement. And this, so I think this was perfect to set the tone for the topic of the day, which is the concept of work-life balance. So again, moving ahead, before I really jump onto this concept, let us just quickly get a hold onto this current situation of COVID that we have been experiencing from the past 1 year. There are 3 questions hamari screen pe. What is it? What is this COVID? What happens to when people get affected by it? Or what are the symptoms? The people on the other side of the screen, I know we are pretty aware of the answers क्योंकि हम ये situation पिछले 1 साल से experience कर रहे हैं. Maybe most of us have gone through it, and every day we are seeing our family, friend, or any relative suffering from it. So again, I'll keep it very short and brief, just so that we can move on to the main topic. We know this coronavirus was caused by a new coronavirus called SARS-CoV-2, and WHO first discovered about this on 31st December 2019 ko, just following a report of a cluster of cases of viral pneumonia in Wuhan. जो बहुत common symptoms हमने experience करे थे, like fever, dry cough, fatigue, or loss of taste or smell, chills or dizziness. कुछ cases में ये symptoms, very severe symptoms have been noticed, like anxiety, depression, or sleep disorders. But over the time, हमने ये देखा, the virus has mutated its form, leading to the second wave that we are currently experiencing. Now, the major difference which we can see in this second wave is कि जो first wave था, उस time पे the population above 50 was being maximum hit by the virus. But if we cut to the second wave, it is now being seen that the younger people, the younger generation that fall in the bracket between 18 to 40 years, they are being most impacted or in fact infected by the virus. Again, moving to the next slide. These are the recent figures just in front of you, indicating the total number of cases along with the recovered ones as well as the deaths. But you must be wondering, what is the reason we started off by presenting and discussing all this about COVID? It is because once again, I wanted to bring into our awareness that what we are dealing with is something that cannot be labeled as normal. ये इतनी unusual situation है, हम पिछले एक साल से experience कर रहे हैं, जिसकी वजह से हम we can easily see बहुत imbalances हो रहे हैं हमारे routines and everyday schedules में, especially as Sneha ma'am also said, when it comes to maintaining that work-life balance. Why? Because again, we are stuck in this work from home situation and we have shifted to this online mode, जिसकी वजह से with all this screen time, it gets a lot more hectic for us. So how we can maintain this, how we can deal with this, कुछ techniques and ma'am ने हमसे already share करी है, and we also have few of the techniques and approaches. So please stay with us till the end. Again, now, again, very short and brief. The slide says the concept of work-life balance simply aims to find a balance between your personal and work life. Isn't it the most simple definition that could have been put there? Indeed it is. But the reality is each and every working professional out there, they are struggling to define it for themselves and let alone achieve it. जैसे मैम ने भी बताया, work-life balance is all about achieving that equilibrium or stability in both our personal and professional lives. But the issue is, अब ये जो इतना ज़्यादा increase in mobile technology के साथ, cloud-based softwares, and because of this easy accessibility of the internet, it has made it very easy for employees to be permanently at work, and that is what blurs the distinction between our personal and professional lives. So I think I'm quite justified at this point, because if we just not consider ye work from home ka scenario, even before that we all carry our work at home, and that is how the imbalance arises. So moving, we have understood what exactly is this whole idea work-life balance ka. So maybe we can just quickly look into ki kaise, how this concept has evolved over time. ये जो वर्क लाइफ बैलेंस के प्रोग्राम्स थे 1930s में, these programs have been reported to be in existence for. एक कंपनी थी द WK Kellogg कंपनी, जिन्होंने इम्प्लीमेंट करा था द 4 shifts of 6 hours to take over the traditional daily 3-hour shifts. और ये जो नया शिफ्ट था, it brought like a massive transformation by increased employee morale and effectiveness. ये जो term है work-life balance, it was formally coined for the very first time 1970s के around. And 1980s में, the companies, they started to offer childcare programs and certain employee assistance programs. Coming down to 1990s, ये वो time था, it was the major era during which the work-life balance programs had a better identification as a vital topic for women. The first gesture of these programs started primarily to support women and children through work-life solutions. And काफी research हुई जिससे पता चला कि job preferences जितने भी होते हैं, they are always based on our work-life issues. So this piece of information was enough, I guess, to learn about the background of this concept and how it has evolved. But ab kyun? Now, what is the situation? Next slide, please. What's happening in this 2000s? How are these years of 2000s different from the past decades? कुछ बहुत major observations note करी गई हैं
कि now people started spending more time at work than anywhere else. इसकी वजह से everybody started to questioning, do we live to work or we work to live? एक बहुत फैसिनेटिंग सा ट्रेंड इमर्ज हुआ वर्क फन फ्यूजन का और फैसिलिटेशन का, कि हाउ कैन वर्क फैसिलिटेट फन. इस वजह से कुछ sudden realizations have popped up. Now people started saying my lifestyle is more important, and they started choosing to have less income instead. Individuals started to drop out of great jobs or careers and started to choose even more rewarding and satisfactory lives. इस वजह से now this interest around this whole idea of work life balance has increased so much. So just again moving ahead, I think all this discussion about the evolution and this whole idea, it might have been a bit monotonous for you all. So there's a very quick, short, interesting activity, a suggestible activity. There are few questions in front of the screen. बहुत simple questions हैं ये, बहुत basic questions हैं. And I really want you all to just note it down, and maybe you can record your responses. I know इस platform पे responses share करना is quite a difficult task, but this will help you to introspect. This will help you to realize, are you actually maintaining a work-life balance in your life or not? What are your working and sleeping hours? Are you giving sufficient time to your dear ones? Are you spending too much time at work even after office hours? Is your sleeping, eating habits or your routine seriously affected? We are really happy to share कि just for this purpose, in order to determine what exactly is the situation now, or लोगों का what are people experiencing, are they able to maintain a balance, हमने ये बहुत एक small survey conduct किया था with a sample of around 100 people. And हमने बहुत ये कुछ questions, we sent out these very few basic questions that we even read on the screen, and we are happy to share the responses. अगर हम बात करें how many hours you give to work daily, so most of them say like 7 to 9 hours, or is it like 5 to 7 hours? अगर हम बात करें how many hours do you sleep, interestingly people say it's either 7 to 8 hours or it's 4 to 5 hours. Again, moving ahead, are you giving sufficient time to your dear ones? A quite balanced data that says either yes or no, like it's 50-50. And do you spend too much time at work even after office hours? And majority of them seem to say yes. But the interesting observation, the most interesting, is your sleeping, eating habits or your routine seriously affected? And 79% agree on it. This helps us to arrive on the conclusion, yes, there is a dire need to balance our lives. And there must be some issue, कुछ root cause होगा इस problem का, और कुछ stresses होंगे हमारी life में जो हमें balance नहीं maintain करने दे रहे हैं. So this will be from my side. So now over to you, Diksha. Thank you.
Thank you so much, Divija, for explaining this topic so peacefully. Now, after observing that survey, I think you all should know about this very interesting topic, which is work-related stress. First, we all experience pressure in our daily lives. It may be from our workplace or home, but there is a difference between pressure and stress. Pressure at our workplaces are unavoidable, but when they become so excessive and unmanageable, then it leads to them stress, which, or we can say, work-related stress. Work-related stress is most commonly identified stress in our working population, and seriously, it does even affects our health and well-being, and also the productivity of our organization. That's why it's important to know about this topic very carefully. Hence, I have also mentioned some work-related hazards which cause stress in all of us. There are two types of hazards. First is work content and then work context. Work content includes job content. जैसे हम जो काम कर रहे हैं उसमें मीनिंगफुल है या नहीं, हमारा इंटरेस्ट है नहीं, देन वर्कलोड, कितना वर्कलोड है, बहुत ज़्यादा काम है करने को या बिल्कुल काम नहीं है, इवन वर्किंग आवर्स, बहुत ज़्यादा वर्किंग आवर्स बढ़ जाते हैं, कभी अब बहुत कम आवर्स होते हैं बट इतना सारा वर्कलोड होता है कि इट्स नॉट एबल टू डू दैट वर्क इन शॉर्ट पीरियड ऑफ टाइम। एंड हमारा पार्टिसिपेशन नहीं है अगर हमारा डिसीजन मेकिंग में, और कंट्रोल नहीं है हमारे वर्क पे, लाइक समवन एल्स इज कंट्रोलिंग अवर वर्क। These all are under work content. Then work context. वर्क कॉन्टेक्स्ट में आता है कि जो आप काम कर रहे हो उससे आपका करियर डेवलप हो रहा है नहीं हो रहा है, एंड आपका स्टेटस जो है वो इंक्रीज हो रहा है नहीं हो रहा है। आप इतना सारा काम कर रहे हो पर आपको इनफ पे नहीं मिलेगा, तो ऑब्वियसली यू विल गेट स्ट्रेस। एंड इसमें ये चीज़ भी आती है कि आपके ऑर्गेनाइजेशन का कल्चर कैसा है, आर देयर पुअर कम्युनिकेशन है या फिर अच्छा कम्युनिकेशन है, एंड लीडरशिप, योर रिलेशनशिप विद योर कलीग्स एंड बॉसेस, कोई कॉन्फ्लिक्ट तो नहीं है, या फिर जॉब इनसिक्योरिटीज, दीज ऑल आर द मेन सोर्सेज ऑफ स्ट्रेस। नाउ इसको और अच्छे से समझाने के लिए मैं एक एग्जांपल देना चाहूंगी। जैसे एक इंसान है, उसको डॉक्टर बनना है, एंड उसने अचीव कर लिया, उसने पढ़ाई करी एंड नाउ ही इज अ डॉक्टर, बट नाउ ही हैज टू वर्क फॉर 10 to 12 आवर्स स्ट्रेट विदाउट अ ब्रेक, एंड उसको ये नहीं हो रहा है, ही कांट एबल टू कोप अप। सो इसमें क्या हुआ, इसमें उसका वर्क कॉन्टेक्स्ट तो हो गया फुलफिल, लाइक ही अचीव्ड हिज पैशन, बट जो वर्क कंटेंट है वो उसको कोप नहीं कर पा रहा है, इट इज नॉट मैचिंग विद हिज एबिलिटी, सो दैट्स व्हाई इट इज कॉजिंग हिम स्ट्रेस। इसलिए इसका सोल्यूशन क्या है, फर्स्ट वी नीड टू अंडरस्टैंड दैट वर्क इज अ पार्ट ऑफ अवर लाइफ, इट इज नॉट होल ऑफ इट, राइट। हमारा काम एक सिर्फ हिस्सा है हमारी लाइफ का, एंड इसलिए हम, ये भी इम्पोर्टेंट है कि हम वर्क रिलेटेड स्ट्रेस को एक सिग्निफिकेंट हेल्थ या सेफ्टी इशू समझें, बिकॉज इट कैन डैमेज अवर मेंटल हेल्थ एंड कॉन्सेंट्रेशन। दैट्स व्हाई we have to detect whether we are experiencing work related stress or not, and then find its solution to heal us. So in a next slide, I have also mentioned some signs and symptoms related to work related stress, and these are suggested by World Health Organization, which are like insomnia, नींद आना या बिल्कुल ना आना, बहुत कम आना, शॉर्ट टेम्पर, आप बात बात पे बहुत ज्यादा रिएक्ट करने लग गए, आपको बहुत ज्यादा गुस्सा आने लग जाता है, या फिर कुछ लोगों का पूरे दिन लो मूड रहता है जिसकी वजह से अल्कोहल कंजम्पशन या कैफीन कंजम्पशन भी बढ़ जाता है उनका, एंड उनके काम में उनकी प्रोडक्टिविटी नहीं आ रही है, जो डिजायर्ड आउटकम है वो नहीं अचीव कर पा रहे हैं, एंड जिसकी वजह से वो अंडर अचीवमेंट भी फील करने लग जाते हैं, या फिर इवन केसेस ऐसे हैं कि लोग, हम रोज जल्दी जल्दी बीमार पड़ने रहते हैं, कि हर रोज हेडेक हो रहा है या फिर फीवर हो रहा है, देन absence in the workplace. So moving to the next slide, I think I have this small and super easy activity for you all, which you can do at your workplace or with your employees so that you can achieve work-life balance. There are 3 simple steps. So first is prepare a log of time, like you आप जितने बजे आप ऑफिस जा रहे हो वो लिखो कि आप कब गए, then you when came back, and कितने कौन सा आपने टास्क करे at what time, देन जॉट डाउन, कि जैसे जॉट डाउन करोगे, आज जैसे आपने 8 आवर्स का करा है ना, 6 आवर्स जो आपके थे वो यूज हो गए बहुत सही से, पर 2 आवर्स आपके मिस यूज हो गया, आपने कुछ नहीं करा, तो यू हैव टू जॉट डाउन कि आपने कितना टाइम यूज करा और कितना मिस यूज। एंड थर्ड इज डायग्नोस में आपको कहना है कि जो आपका काम टाइम मिस यूज हुआ वो क्यों हुआ, लाइक क्या रीजन था उसके पीछे, आप कॉन्सेंट्रेट नहीं कर पा रहे थे, या फिर आप किसी से बातें कर रहे थे, या बहुत चीजें हो सकती हैं, बहुत सारे रीजंस हो सकते हैं, यू हैव टू फाइंड योर स्पेसिफिक प्रॉब्लम उसके पीछे का, and why it is important, because to find a solution first we have to know our problem well, and don't worry, every problem has its solution. So also idhar I would like to ask for any volunteer from audience if they can come forward and share their experience if they are facing any problem in balancing work and life, if anyone. Are we getting any responses?
as of now, Deeksha, we do not have any response.
I think we had a volunteer, Mrs. Vandana ma'am. Is she here? Maybe she is here.
Yes,
could
I
just
am here. Not Mrs. Vandana. I am Dr. Miss Vandana.
Welcome, ma'am.
Oh,
Can you
good
share
evening,
your
everybody.
experience with us?
My experience, should I need to speak about my problem, or should I tell about how I balance, how I do what I need to share? Actually,
Ma'am, you can share your problem, like what problem you are experiencing balancing your work and life.
problems are not too many. Just in this year in COVID, कुछ थोड़ी सी problems हैं. I am a bilingual. I would
Yes, ma'am.
also like to tell कि last year क्या हुआ था. ये COVID last year से चल रहा है. तो last year it was okay. थोड़ा सा time मैंने जो कभी भी किया नहीं in my whole life, जो काम मैंने नहीं किया था actually, mates वगैरह ऐसा कभी नहीं हुआ कि mates नहीं आ रही हूँ. हमेशा like during my जब मैं अपना PG कर रही थी and जब मैं job कर रही थी कहीं बाहर, हमेशा मेरे साथ. और अभी मैं जब अपने पेरेंट्स के साथ यहाँ रह रही हूँ, आई एम सिंगल, स्टेइंग विद माय पेरेंट्स. तो मेरे पेरेंट्स भी 75 इयर्स, माय मदर एंड माय फादर इज 82 इयर्स. तो लास्ट ईयर तो ठीक है, आई वाज बिजी विद हाउस होल्ड वर्क. वो अच्छा भी है एक तरह से, क्योंकि नहीं है तो आप उसमें काम में लगे हैं, यू आर इन्वॉल्व. क्लिनिक मेरा बंद था एंड जस्ट बिफोर कोरोना मैंने छोड़ा था प्रसाद मेडिकल कॉलेज में. मैं असिस्टेंट प्रोफेसर थी in Banthra, Prasad Medical College. Just before this COVID period in November, I left from there. I left my job and I was about to switch to another medical college. But then हम लोगों के एग्जाम्स भी तभी हुए हैं ये MA साइकोलॉजी के, दिसंबर एंड जनवरी. सो आई थॉट मैं अच्छे से वो प्रिपरेशन करके भी एग्जाम दूंगी और उसके बाद आई विल ज्वाइन अनदर जॉब. तो मॉर्निंग में मैं जॉब में एंड इवनिंग में मैं प्रैक्टिस करती हूँ, रनिंग माय ओन क्लिनिक. तो वो भी कोविड में फिर जब ये लॉकडाउन एंड ऑल, फिर मैंने अपनी क्लिनिक बंद कर दी, क्योंकि उसके लिए जितने सारे कुछ ये नॉर्म्स, कुछ गवर्नमेंट की तरफ से, कुछ हम लोगों की तरफ से जो कुछ था वो नहीं हो पा रहा था. तो देन फिर घर के काम में भी बिजी. तो लास्ट ईयर तो मुझे कुछ इतना ऐसा प्रॉब्लम नहीं हुआ अपनी जितनी, बल्कि एक ये अच्छा था. मैं ये भी शेयर करना चाह रही हूँ व्हाट वाज गुड. उस टाइम में मैंने अपनी जो हॉबी, मेरी लिखने की हॉबी है, वो इतना ज्यादा अच्छा हुआ कि मेरी पोइट्री की एक बुक भी छपी है अगस्त 2020 में. एंड देन गार्डनिंग और ये सब जो था, ये सब मैं करती थी. और किसी को कोई जरूरत है तो मैं टेली कंसल्टेशन, फ्री कंसल्टेशन लोगों को, ये था मेरा. बट दिस ईयर तो सबको पता है क्या डिफरेंस आया है. इस बार जो कोविड है वो कैसा है. इस बार ये जो मंथ था, बल्कि 7 to 10 डेज जो बीच में हुआ है, तो जो प्रॉब्लम्स आई हैं मुझे जिस तरह की, एक तो ये है कि पेरेंट्स को, मदर तो ठीक है वो तो समझती हैं. अब 82 इयर्स प्लस मेरे फादर जो हैं, ही इज वेरी एक्टिव. उनको मॉर्निंग में वॉक पे जाने का और ये सब था, उनको घर में रोकना. शायद समझते हैं जिन लोगों का तरह का वो होगा, वो शायद समझ सकते हैं ये प्रॉब्लम क्या होती है. उनको घर में रोक के रखना, एक तो ये प्रॉब्लम है. होम वर्क लाइफ बैलेंस में बात कर रही हूँ एक्चुअली. मैं दूसरी बात भी कर रही हूँ वर्क के अलावा भी, कि किस किस तरह से सारी चीजें इकट्ठा होके वो हो जाती है. तो और उसके बाद अभी जो ये हुआ है, तो बीइंग अ प्रोफेशनल जो मेरा फील्ड है, अब उससे मैं जोड़ के बात कर रही हूँ कि am I audible?
Yes, ma'am, you are.
Okay. So किसी को भी कोई जरूरत है 24 आवर्स. वैसे मेरा फोन जो है, वैसे भी कभी मैं ऑफ करती नहीं हूँ फोन, अपना ऑन हमेशा रहता है और कभी भी म्यूट भी नहीं करती हूँ फोन को. लेकिन पहले क्या होता था कि कभी अगर आया कॉल तो अननोन पर्सन है तो मैं अटेंड नहीं करूंगी. बट अभी क्या है कि किसी का जो स्थिति चल लगता है, किसी को भी कौन किस स्थिति में है, एंड 100% मैंने सबका कॉल अटेंड किया। लोग होम आइसोलेशन में है, और मैं ये बताना चाह रही हूँ कि मेरा दायरा जो है मेरा बहुत बड़ा है, बड़ा इन द सेंस कि सारी से जुड़ी हुई हूँ। मेरा म्यूजिक का भी फील्ड है, तो
Yes, ma'am, you can continue.
यस तो पहले तो ये था कि मैं जाती थी, मैं पूरा कॉलेज से अपना 4 o'clock वहां से वापस आती थी, मैं खुद ड्राइव करती थी पंतरा से, वहां से आके मैं अपनी म्यूजिक क्लास में जाती थी। उसके बाद म्यूजिक क्लास वो करके फिर मैं आती थी इवनिंग में, बस चाय पीने के बाद में अपना क्लिनिक में पेशेंट्स हैं, मैं वो अपना देखने लग जाती। ये मेरा पूरा रूटीन था। तो उसमें जो यूजुअल सबको आती तो थोड़ी बहुत कभी कभी आती हैं, जो टाइम के साथ आती हैं, ऐसा कुछ नहीं था, एक वो बना हुआ था। तो अभी क्या है कि मेरा वो साइकोलॉजी का भी हो गया। और साइकोलॉजी मैंने क्यों ज्वाइन किया है, क्योंकि मेरा पहले से भी हमेशा ये है कि हम लोग जो भी बात कर रहे हैं मेंटल हेल्थ, मैं थोड़ा अपना भी बताना चाहती हूँ। हम लोग जो पढ़ते हैं, हमारे प्रोफेशन में जो पढ़ाया जाता है कि हेल्थ इज नॉट mere absence of disease, it's all about your physical, mental, emotional, like everybody else has spoken, spiritual, social well-being. तो मुझे हमेशा लगता था कि जो जितनी भी बीमारियां हैं, वैसे तो मैं आई स्पेशलिस्ट हूँ, आई सर्जन हूँ, बट क्या है, और जो भी पेशेंट को जो भी प्रॉब्लम्स हैं, सबका रिलेशन मुझे लगता था होलिस्टिक अप्रोच मुझे चाहिए। तो जो कि मेरा नेचर है, मैं अपने नेचर से जोड़ के ये बातें बताना चाहती हूँ कि प्रॉब्लम्स क्यों हो रही, मुझे पता है, अपनी
Yes, ma'am.
एनालिसिस खुद भी बता रही हूँ कि क्यों ऐसा हुआ। तो वो जो एक सबको हेल्प करने का होता है ना, कि हर तरह से लोगों को आप हेल्प कर सकते। अदरवाइज ऑल्सो आई एम इन हैबिट ऑफ काउंसलिंग, कि मैं आई के बारे में तो बोलूंगी, और मैं बहुत उसका रूट कॉज जो होगा मैं उसे पेशेंट को वो एक्सप्लेन करके बताऊंगी। उसको टाइम, अगर मेरे पास टाइम है तो मैं उसको पूरा टाइम लेके ये बताऊंगी। ये मेरी हैबिट है, और उसी वजह से मैंने ये फॉर्मल जो है कि मैं साइकोलॉजी में मैंने ज्वाइन करा। तो अभी क्या हुआ कि ये 1 मई से इंटर्नशिप भी शुरू हो गई, जो कि पता नहीं था कि ये कितना कोविड बढ़ने वाला है और कैसे मैनेज होगा, क्या होगा।
Yes,
लोगों
ma'am.
को तो ये नहीं पता है, एक मेन आइडेंटिटी लोगों को पता है कि यू आर एन आई स्पेशलिस्ट, यू आर अ मेडिको, आप एमबीबीएस हैं, आपको ये नॉलेज है। तो जिन लोगों को जरूरत है वो आपको किस तरह से देख रहे हैं और क्या है, वो उनको नहीं समझ में आ रहा। तो 24 आवर्स मेरे पास, रात में भी हर समय मेरे पास इतने कॉल आए, और मैंने सबके कॉल अटेंड किए। क्यों? मेरा नेचर है ये, चाहती नहीं भी कर सकती थी। हर समय किसी ना किसी को कुछ बताना, समझाना, जो हाँ होम आइसोलेशन में है, मेडिसिन उसको बता दी। क्या हालत थी, हेल्थ प्रोफेशनल्स कितने कम थे, आप सब लोगों को पता है। डॉक्टर पॉपुलेशन रेशियो क्या था, लोगों को सर्विसेज नहीं मिल पा रही थी। तो मेरे रिलेटिव्स हैं, मेरे एक्वेंटेंसेस हैं, मेरे जितनी भी फील्ड के लोग हैं, एक फोन खत्म नहीं होता था कि दूसरा फोन, बल्कि मैं कॉल पे हूँ और दूसरा कॉल आ रहा है, ऐसा होता था। तो मेरा खाना, एंड हाँ, जो मैं एक बात बताना भूल गई, आई वाज आल्सो हैविंग फीवर। मुझे भी फीवर चल रहा था, 1 वीक से फीवर था। उस समय की ये बात है जब ये सब हुआ। तो उसमें मैं सब कर रही थी, तो मेरा खाना भी उसमें टाइम निकल गया, लंच नहीं हुआ। अब मदर है, आई एम 50+, लेकिन मदर है तो मदर को तो लगेगा, और किसी को नहीं लग रहा। तो मेरी मदर अभी भी फोन, जब आओ तब फोन, हर समय तुम फोन पे, खुद खाना नहीं खाना है, मतलब इस तरह से जैसे होता होगा, और सबके यहाँ भी इस तरह से हुआ। फिर वो समहाउ,
Yes, ma'am. हम सब भी देखते हैं ये सब.
आप सुन पा रहे हैं मुझे?
हाँ जी, मैम.
आई एम ऑडिबल?
Yes, ma'am, you are.
हेलो,
And
एम आई
hello,
ऑडिबल?
ma'am. Yes, ma'am. And मैं कहना चाहूँगी कि हमें अच्छा लगा बहुत आपकी एक्सपीरियंस सुन के, एंड वी ऑल कैन रिलेट थोड़ा थोड़ा इससे.
यस, एंड अ परफेक्शनिस्ट
एंड
काइंड ऑफ एटीट्यूड। तो मैं कुछ बताना भी चाह रही हूँ कि मेरी प्रॉब्लम तो है, लेकिन आई चेंज माई सेल्फ अ लॉट। मैंने, मतलब ये मेरा शुरू से है नेचर, कि लाइक स्कूल टाइम से हेल्प करना। दो लोगों का आपस में झगड़ा हो गया इन माई कॉलेज टाइम, एमबीबीएस में, एमएस में, बहुत क्लोज फ्रेंड्स हैं, एंड बोथ ऑफ देम आर माई फ्रेंड्स। उनका आपस में हो गया, मेरे से नहीं है, दोनों को वो करना। तो ये इस तरह की चीजें मेरे अंदर रही हैं। तो कभी कभी क्या होता है, और बहुत सारी चीजें, मेरी हॉबीज बहुत सारी, म्यूजिक का बहुत अचीवमेंट्स मतलब मेरे पास हैं, लेकिन वही वर्क लाइफ उसकी बात हुई ना कि आप काम में कह लीजिए या हॉबीज कह लीजिए, कुछ भी चीज आप कर तो अपने लिए रहे हैं, अपने सेटिस्फेक्शन के लिए कर रहे हैं, लेकिन फिर जब घर में घर वालों को भी तकलीफ होती है कि मतलब यू आर नॉट ईटिंग, आप टाइम से खाना नहीं खा रहे हैं और फिर आप बोल रहे हैं, फिर वो क्या होता है, वो घर पे ही होता है, फिर आप चिड़चिड़ा के किससे बोलेंगे, घर वालों से ही बोलेंगे। कॉल जो आ रहा है उससे तो आप बहुत अच्छे से समझा के बहुत प्यार से कि नहीं आप ऐसे कर लीजिए, ऐसे कर लीजिए ये, लेकिन घर में क्या होगा, ठीक है सबसे तो बोलो, सबकी केयर करो, हम लोग ही हैं ऐसे, ये सबके साथ ये होता है, मेरे साथ भी है कि घर में, तो कहीं ना कहीं वो घर वालों की भी थोड़ा सा, मेरी जो अपनी हेल्थ है, मेरा पूरा स्लीप पैटर्न मेरी पूरी डिस्टर्ब हो गई, क्योंकि जब इस समय रात को कॉल आ रहा, अब एक बार अगर नींद।
तो यस मैम, हम सब ये एक्सपीरियंस कर रहे हैं, ये सारी चीज़ें, एंड इसी को मैं आगे बढ़ाना चाहूँगी कि after listening her your problem, I think there is a special serious need for us to balancing our work and life, because जैसे दिव्या ने बताया, वर्क और लाइफ बैलेंस करना काफी इंपॉर्टेंट है, एंड इट सिंपली मीन्स कि सेपरेट योर पर्सनल लाइफ फ्रॉम प्रोफेशनल लाइफ। जैसे उन्होंने बताया कि वो रात रात को भी कॉल्स आ रहे हैं, तो इट इज देयर इज सम इम्बैलेंस, एंड देखिए दोनों चीजें इंपॉर्टेंट एंड वी कांट इग्नोर एनीवन, बट हमें समझना पड़ेगा कि जो पीपल नहीं कर पाते वर्क लाइफ बैलेंस, इट कैन लीड देम टू और हार्मफुल इफेक्ट्स लाइक हाइपरटेंशन, डाइजेस्टिव ट्रबल्स और क्रोनिक एक्स, एवन इवन हमारी जो मेंटल हेल्थ है वो बहुत ज़्यादा डिटेरियोरेट हो जाती है। जैसे इट कैन लीड अस टू डिप्रेशन और एनजाइटी और इंसोमिया, एंड इवन टू मच स्ट्रेस हमें लीड कर सकता है वर्क प्लेस बर्नआउट से, जिसमें हम बिल्कुल एग्जॉस्ट हो जाते हैं, हमारा मन नहीं करता कि और कुछ करने का। इसलिए I would like to conclude by saying that maintaining a work-life balance is very important for all of us, and we should encourage ourselves and others around us to take time off, leave work and work, and try to enjoy your life and hobbies also. Now, I would like to call upon Ayush to take forward this webinar.
Thank you so much, Diksha, Devaja, and Vandana, ma'am. Now, followed by the work exhaustion model. Can you please move the slide? Yes, this model. So, followed by the work exhaustion model, there is one another model like abhi last slide में हमने techniques पढ़ी how to achieve it. Now we are going to study about the model given by the Abraham Maslow, who is an American psychologist and best known for hierarchy of needs. उन्होंने इस मॉडल के जरिए बताया कि वी हैव द नीड्स, द फिजियोलॉजिकल, सेफ्टी, लव, बिलोंगिंगनेस, सेल्फ एस्टीम एंड सेल्फ एक्चुअलाइजेशन। उन्होंने फिजियोलॉजिकल नीड्स में बताया कि दिस इज द बॉडीली नीड्स जो कि हमारी बॉडी डिमांड करती है, जैसे कि फूड, सेक्स, हंगर, थर्स्ट, एग्रेशन, these all comes under the physiological needs. Once this physiological need completed, we move towards the upward needs like safety, love, belongingness, self-esteem और एंड में सेल्फ एक्चुअलाइजेशन जो कि बात करता है मोरालिटी, क्रिएटिविटी और प्रॉब्लम सॉल्विंग की। नाउ अब इस पैंडेमिक सिचुएशन में हाउ कोविड इंपैक्टेड आवर फिजियोलॉजिकल नीड, आवर बेसिक नीड। अगर हम वर्क लाइफ इम्बैलेंसेस देखें कि कोविड ने इंपैक्ट किया वर्क लाइफ बैलेंस को कैसे, अगर हम बात करें पे डिग्रेडेशन की, जॉब लॉस की, अगर हम बात करें इनकम लॉस की, लाइक अनएम्प्लॉयमेंट रेट इंक्रीज्ड। So absolutely, कहीं ना कहीं अगर हम देखें तो COVID impacted the physiological need, that is hunger, and thus we cannot able to raise the stairs. और अगर हम इसका इंसिडेंट देखें, लास्ट ईयर 2020 में हमने देखा था कि मेजॉरिटी ऑफ द पॉपुलेशन मूव फ्रॉम द रूरल एरिया टू द अर्बन एरिया, and we could clearly able to see that. So next slide, please. And this is where I put myself here trying to elaborate on the need for balancing work and life during lockdown. We just literally saw in the previous slide about how COVID impacted the basic physiological need. And thus we could not able to raise the stairs because base is what we need to establish. And in this slide, and in particular this slide, we are going to talk about the need for कौन सी ज़रूरतें हैं जो कि हमें maintain करनी चाहिए during the lockdown. And I really wanted to add my personal observation here because I don't see any of the platform or opportunity apart from it. And the incident that I've noticed is of my father. I have seen my father. He holds the company. He's a businessman. He had put all the efforts establishing it and focuses towards the growth of the institution. He comes home with this bulk of pressure. And I could clearly see some imbalances are there between his work and life. And we as a family could clearly saw some signs and symptoms related work stress. His sleep impacted, his eating habits impacted, improper scheduling was there. He could not able to schedule his proper work, like if I have to give the example. And in the last, apprehension towards the income retardation. Apprehension means बार-बार उस चीज के बारे में सोचना. So because during the lockdown, when he's just using his laptop a whole day and do work from home, he has all the motive to sustain the activity for the good. He works like and there like a whole day he works, he worries all the time for the family, he worries for the employees working in the institution. And I mentioned that's why there must be a need for balancing work and life during the lockdown. And there myself as a son, I invited my father too in this webinar session to get to know the concept of the work life and how to achieve it. Now moving ahead, now let the webinar move towards the last topic of the session. It is the significant of this of the session, the approaches and how to achieve the work life. अभी हमने पीछे work content और work context की बात करी. Devajay explained the evolution part. Deeksha told the work content and work context. Just हमें पता लगा कि like if the doctor maintained his work-life balance, like आधा career अगर if he or she goes towards the career development, if he or she want to become a doctor and he did that, after still he getting the hectic in the job getting hectic in their head, hectic in the brain. So what's the solution? That's why we are the learning the life approaches here. The first three approaches here: schedule scrupulously, determine our priorities, and set specific goals. Schedule scrupulously माने बार बार चीजों को schedule करना, prioritize. और अगर हम इन तीन approaches को देखें, so अगर एक term आती है, then it's like prioritize the things. So let's start an example from the students and end with the people working in the institution. Student in the school, colleges get the assignments, works, and the learning materials of every subject they're in. They are getting the co-curricular activity, the co-cultural activity, and somewhere it is mandatory for them to take a role on it. And this daily basis task becoming heck in their heads, becoming the web in their mind. And they started implicating that why we're getting so much assignment, why we're getting so much task to do it. But don't you think that instead of demanding a change, we must have the ability to divide the work accordingly? And because whatsoever being given to us, it's for the good, and we have to accept it with the full of receptivity. So in तीनों approaches के लिए, schedule, determine our priorities, and set specific goal, we have the activity on the next slide. And this is the intrinsic and suggestible activity for all the general population right there. Only if you're like motivated enough and you have a willing to change in yourself, this is the kind of best activity that I have ever met to share. इस activity का नाम 1+1=53 planning formula कहा गया. इसको कहा गया. Why this is called 1+1=53? Because इसके अंदर हमारी दो सब activities आती हैं. और ये कहा जाता है कि अगर उन दो सब एक्टिविटीज को हम वीकली वाइज मेंटेन करें, सो वी आर गोइंग टू मेंटेन द 52 और 53 वीक एक्टिविटी थ्रू आउट द ईयर. दिस एक्टिविटी टोटली फोकस फॉर द मेडिकल प्रोफेशन, टू द टीनेजर्स who is studying in a college and schools. This is the best activity that I have met to share with, and I personally conducted this activity last year, and I could clearly decompartmentalize the things between the two. And I must say this is for you. For this activity, you must have take the two things in a handy: a simple list and the bucket list. Simple list item वो item है जो कि short term के basis पर, यानी कि आपने ऐसी activities maintain करी हैं weekly wise. आप weekly wise उन short term activities को maintain करते हैं. The example that I included in my simple list last year, I had mentioned that I had to take a walk. I had to spend the time with my parents, with my siblings, a yoga hour, watch a movie, and play a soothing music. So this was a simple list. What's your list? Every list is different from like opinion to opinion. The second list is the bucket list. Bucket list item means long-term basis पर activity आप perform करते हैं weekly basis पर. Like I personally, if I had mentioned to tell you about the bucket list item that I have mentioned the last year, I would say I had planned to take a trip on the southern side of the India, but due to the pandemic situation, I could not able to do that. But that's okay. You may skip the activity for the next year. And so moving ahead, after like here's how the 1+1 work-life balance processes works. Once a week, do 2 things. And so here's written that pick one simple work-life balance activity to do for yourself in this week. Put it in your schedule for the week. सिंपल लिस्ट लीजिए, उसमें अपनी एक्टिविटी जो आपने वीकली बेसिस पर मेंशन करी है उसको लिखिए and try to achieve it. Again, I'm saying if you are the motivated enough to do, if you're facing any kind of like imbalancing by your own, there is an activity for you. Pick the next step in the action plan for your bucket list item. That may be the long-term basis that you are making reservations, getting passport, any activity that keep the bucket list item moving forward. Now, pick the step you will take this week and put it in your schedule. On the next slide, we are going to talk about what you need to do during the week. So it is like complete these 2 activities. After completion, check them off of the worksheet that if you could able to do this activity or not. And after, once you've completed, once you've checked, celebrate with a pat on the back. Whatever your victory is, done for a job well done. Repeat weekly. Now, this is one of the significant phenomena. Repeat this activity, and at the end of the year, you will have completed a bucket list item for the 2021. Congratulations if you completed that. Completed 52 work-life balance activity for yourself that would have not gotten done anyway. And the third, developed the habit of weekly planning for the work-life balance. And this is one of the significant things you can do. On the next slide, after this activity, abhi humne 3 approaches पढ़े, schedule scrupulously, prioritizing the things, set specific goal. फिर हमने उन तीनों को compilation करके एक activity देखी, where we could able to do that. And on this side, we have the 3 approaches, like exercise your option, work smarter, not harder, ability when to ask help. Now like after this activity, exercise your option, again, how you prioritizing the thing. Work smarter, not harder. This concept basically originated in the 1930s. जब दिव्या ने पीछे evolution की बात करी, तो इन्होंने बताया कि 1930s, तो ये जो concept है work smarter का, ये भी 1930s से आया. और अगर मैं इसका best example दूं, तो if like you have to maintain the 12-day task, okay, on the basis of the mode of difficulty level. Like first day, it is easy, then moderate, then difficult. What you're going to do? Half of the population do the jumble things. Like वो कभी पहले difficult task को perform करेंगी, then moderate, then easy, according to their will. They will going to skip the 1 day. It's not a hard work, sorry. You need to maintain it on the daily basis according to the mode of difficulties. Like on a first day, you can do the easy task, then the moderate one, then the difficult one, because for it you will be flowing in it. And on the third approach is the one of the most significant approach where one could ask for the help. Or agar aapko lagta hai that you are facing some imbalances, why to hesitate? Why to shy? So for this domain, we have the Indian Mental Health and Research Center where we are in. It is one of the renowned and the credential institute for like someone who can actually engage in and to share and ask for our help. And moving again on the next slide, it's a concluding note, and it says that no one ever said on their deathbed, gee, I wish I had spent more time alone with my. So what does that mean? It simply refers that none of us would going to discuss about the work, how much time we spent in. No one going to discuss about it. So it's our step our responsibility, our duty to maintain the work and maintaining our supreme life. And again, that thank you for all like being in this webinar from the beginning and giving your precious time. I hope this whole session of activities, approaches, and techniques will surely help you to balance in your life. And again, I'm saying it to you that if you have the willing to change, if you are motivated enough, this is the best thing you can do to achieve it. And no one can bind you. Now, if you have any doubt, query, and want some clarity, put it out in the chat box. Thank you so much from my side.
Thank you so much, Deeksha, Divija, and Ayush. It was really a very nice and informative presentation. I really enjoyed the activities which you all have just presented, and I'm sure the audience might have also enjoyed. So moving further, we will be taking the question and answers. Zaidi sir. Sir, the पहला question sir आपके लिए है.
जी बताएं.
ये जानना चाहते हैं how to take care of mental health of the caregivers of COVID-19 patient.
You see that COVID-19 patient कोई अलग से entity नहीं है. They may have slightly different nature of problems. So caregiver की care करना अपने आप में एक special branch है. And there are many people who are doing research and thesis. Caregiver of Alzheimer cases, very difficult. Far difficult than COVID. COVID is still a time limiting crisis. 12 days and 14 days, 28 days. Hopefully within a month or two, he would not have a bedside nursing. He would not require bedside nursing and care. Only thing that he has to get some support. The caregiver of patient cases, so it is still much more difficult. So few things, if you know few tips, you can definitely get. First of all, that you should not demoralize them by, as I've been telling you, that by giving all type of stories that you are taking care of your wife or child or son or whoever is there. And today somebody has every day, there would be a phone call from your family members, your relatives and all these things, sharing the news of very unfortunate demise. I don't know what concrete gain you are getting out of it, except sharing your information or anything else, or narrating or expressing, which we call in the psychology the express emotions. कि अब आप इतना मेहनत कर रहे हैं, इससे पहले अगर आप इनकी इम्यूनिटी का खाने पीने का ध्यान रखे होते, because it is one thing very clear about this thing, that the patient who could not recover fast has a lower immunity, and lowering of immunity is not overnight. It speaks the history, it speaks the story of negligence in either food habits or whatever way it could be. It is negligence. Otherwise, the body has its own way of fighting back with the infections. So at that moment, if that type of crisis if that type of things is being shared and commented upon the caregivers, it will further demoralize. The next point is that he should also get some time to rest. And here, till the patient is active, no caregivers is allowed to go inside the hospital. So that time the patients are being taken care of, the professionals and all these things. Once he's back to home, yes, it has to be shared. It should not be the responsibility of only one individual, because now she or he is a negative case. The infection, the chances of being infected is reduced to the minimum, or rather nil, because she is negative. So it has to be shared with this. And if possible, professional caregivers can also be engaged for some time. Nurses are available and all this thing. So it will be a shared burden. So this is what I thought that I should tell you, that caregivers of COVID is not a special entity. The cancer patients caregivers, the Alzheimer cases caregivers are still more difficult situation than the COVID case. Am I clear to you, Divya?
Yes, sir. Yes, sir.
could I explain that whoever has asked this question, if she is or he is hearing, I would like her comment or his comment on this. Who has asked this question? Very right question.
I'll check with my team, and they are just responding if the participant is present in the meeting right now or not.
If she is convinced with my answer, it's okay. Otherwise, I would like to explain further.
Sir, I think the participant is not currently present in the meeting.
Okay, fine. For others, it's fine.
Thank you.
So
Sneha,
we have one more question from Dr. Shamshi.
Yes.
His question is how to handle the patient of delirium after COVID.
How to handle the patient?
Of delirium after COVID.
Delirium.
Yes.
It is, COVID has definitely induced some confusion, but is self-limiting. It is not a long standing. There is no such studies where it is mentioned that there is a permanent damage. And for any confusions, the caregiver has to be patient enough to explain, to tell one thing number of times, and to provide some clues where the patient can get some answer. The very common question is, which day is that? Abhi kitna baja hoga? Aaj kaun si date hai? So if the calendar is there, if the watch is there, the person will solve its own questions. Otherwise, not a severe confusion and not a severe disorientation is reported. Some mild temporarily self-limiting disorientation, yes, it is there, because particularly if the patient has been in the ICU is such a covered area where every 24 hours there is a light, there is a darkness, there is no air is coming from inside. So practically you cannot make it out that where you are. It is dark, and the patient is all the time either sleepy or semi-sleepy or they're drowsy. So this type of condition is there. So that is a very temporary things. In a very exceptional case, if the confusion is persisting, then that may require the intervention by a neurologist. But I'm sure that after COVID, some relaxation, some psychotherapy, some relaxation exercise, some yoga is very important with this. And patient will recover with all type of confusion and disorientation. Yes, but disorientation, confusion is reported. Self-limiting, self-recoverable, reversible confusion, not the permanent confusion. Any other information? Any other question?
No, sir. Thank you, sir. Sneha ma'am, the next question is for you.
Yeah.
One participant has asked that how to deal with productivity guilt.
Okay, so that would be indicating that it's like a lot of time given to the work and a little bit of time given to the family, right?
Yes.
A lot of us are facing that at this point of time, and there is no way to say that we will not be repeating that again. As I said at the beginning of the session, that most of the time we are indebted to our organizations because we are getting the financial benefit from them. So we feel like if we are not being productive, even if we are not well, I've seen that as well, even if we are not well and we are not giving our 100% to the organization, we feel that this should not be the right way. But just the reverse of it does not happen that much, where your family is not getting the 100% attention of yours and your work is getting 100%. Whenever that happens, it is either one way shot going on, that in the workplace I am very good, but my family life is not that much balance. So again, we need to strike a balance here. Balance in the sense that it's okay, work is something that we have to aspire to do, which is getting payment for us, and that is in one way supporting our family, right? Without that, we can't go ahead and have a good family life. But yes, we need to have a balance where we are able to introspect what we want. Like we can take a step back and we can relax as well, and then we can give time to our family members as well. So I think the steps that I said in a cycle position: take a pause. If you're feeling that guilt, take a pause, reorient yourself that where do you want your priorities to lie, and try and understand better how can you balance it out, whether your work environment or your family environment. All right.
Yes, ma'am. Thank you so much, ma'am.
Divya, can I add one or two things more?
Yes, sir, sure.
So for the caregivers, care of caregivers, I have only given you the two examples, Alzheimer's and cancer. The worst condition of the parents of a spastic child, one who is all the time for lifelong, would be if the spastic child is surviving for a longer time, and they survive for a pretty longer time. So if he is on the wheelchair, totally depending about everything, including cleaning and toileting and everything, so they deserve more caregivers care than COVID. COVID is only 1 month, 1.5 months, 2 months maximum stress, and thereafter situation will be rectified. Another thing which I forgot to tell you when I was making my presentation, that one very particularly for those who has some social sense and ethics, that the person who has treated you have never seen him. You are not aware that who is giving you injection, who is giving you medicine, for what the medicine is given, because it is only one-way traffic. He is under total PPE. You cannot recognize. Even sometime I had to ask him, ma'am, you are, even the gender difference, sometimes it was difficult unless the person who is a PPE is speaking, then you can make it out that it is a boys and girl. Whether you are, unless the person is carrying the jhadu or duster or your bed sheet to change, you cannot make it out that what is his level or what is the profession is. And very interesting thing that I used to interact with the doctors and all this. And as my nature is that, just to humor them, sometimes some comments, sometimes something, and they used to like my interaction. So whenever they used to tired, they used to come in my room, and they used to. And one comment was that, sir, working in COVID and laughing, these are two different things. But you made us laugh. So that way they develop understanding with me and all these things. After discharge, when I went for some other purpose, 3 young doctors came to me, uncle, how are you? Where are you now? Have you gone? This and that. And I did not know these are the same girls, same doctors, young doctors to whom I've been interacting. Till they spoke to me. Then I realized the potential of blind person who can make it out through voice and not by the face, because he never seen the face. So this was a very unique, and for social reasons, for ethical reasons, it also causes you stress. Not to the extent you become absolutely disturbed, but sometimes I felt very ashamed that these boys, these girls, these residents has helped me for 2 weeks, 3 weeks. And I did not recognize them. But when I start talking, then I said, okay, you are such and such, you are Dr. Sujata, you are Dr. Madhulika, and Dr. Zahra. There were 3 doctors who were attending me and who used to come for chatting with me. So this is exactly something which is also very unique experience. Okay, I think it's time to wind up. I think so, because it is already.
So बहुत शुक्रिया. आपका ये एक्सपीरियंस शायद हम सबके लिए बहुत नॉलेज वाला था, एंड बिल्कुल सही बात है. आपके स्टूडेंट होने के नाते मैं बिल्कुल समझ सकती हूँ कि आप जहाँ जाते हैं वहाँ पे कुछ मिनट के लिए तो इंसान हंसी देता है, चाहे कितना भी स्ट्रेस में हो. Thank you so much, sir. So with this, we have come to the end.
Divya ma'am.
Yes.
Divya ma'am.
Yes, sir.
We have another question from for Zaidi sir from Dr. Mayank.
Okay, sir.
So,
okay, sir.
Sir, can I put up one more question?
Sure.
Seems interesting. Yeah. So he is asking that.
Online है, कमरा बंद, भाग के तो जा ही नहीं सकते यार.
So nice of you, sir.
चलो.
Sir, he is asking how to introduce and make a patient that their repetitive, cautious behavior of washing hands, sanitizing hands has turned into OCD, and how to go ahead in this situation. Sir, again, very
very good questions, Dr. Mayank. you see that the intention of purpose of frequent hand washing is very important. The obsessive compulsive neurotic cases who frequently wash the hand, he washes the hand for no reason. But here, the patient who is sanitizing and washing the hand with definite purpose. So behind every symptoms, you have to see what is the purpose, what is the intention. Just don't take any symptoms as a face value. You have to inquire about it. You have to check and you have to explain. And however, there is a risk if a person is otherwise predisposed for obsessive compulsive neurosis or the frequent hand washing, there is chances of exacerbations of the symptoms when it is that. But by and large, it is not noticed, it is not studied so far that by frequent washing a permanent obsessive compulsive cases or permanent neurotic condition has been erupted. One is hand washing only when it is required, and one should. So every time when you analyze any symptom, you should see that, try to understand what is the causative factor and what is the reason behind particular symptoms. Muttering to self is very, very serious symptom of hallucinations. But if somebody is using Bluetooth and going and you are seeing that he is talking to self, I mean, the result with different circumstances, different situations. So that way everybody would be considered as hallucinating because there is no one, but he is talking, he is giving response to an unknown voice. Yes, he is, but it is monitored by IT, and that is a psychopathology. So I hope it is clear to you. Sajid sir, is that okay?
Yes, sir. Thank you very much, sir. I hope he is satisfied with the response. Sir, he has responded that thank you very much for your clarification in the chat section.
Sir, any other questions? Or shall we move forward? Sajid sir.
Just the last question, that how to deal with the disturbing information coming in the form of news of death due to COVID-19 of the near and dear ones. So I think with this last question, we will wind up the session. Sir, would you like to?
One has to, first of all, one should be sensible in giving the information. One has to filter it out. Sharing with non-COVID person, otherwise, because you cannot stop. Unfortunately, the situation is that. Sabse pehle hum, it is not only giving the information on political issues or election issues, it has become the competition all through. I have given the information sabse pehle hum. I am the first to provide the information. Everybody is becoming the channel, everybody is becoming the anchor and all these things. This is a craze of time. So you have to, by now you would be sensitized to all these things. It would not work. It would not work. Pondicherry में बारिश साल भर होती रहती है, nobody bothered about it. हमारे यहाँ 3 महीना काटना मुश्किल पड़ जाता है. So by now this type of information is coming all through, just like tsunami on the paper and everything. So first of all, that you should not react to it unless it is not coming from a very, very close relative of yours. And if you yourself is having something, the issue should be filtered and issue should be discussed in a less damaging way. I'm not saying that you should not be informed. If somebody very near and dear has died in your family, you should not inform others. It will be still shocking. कि जब उसे एक महीने 15 दिन बाद मालूम होगा कि ये तो 15 दिन पहले ऐसा हो गया. So it will be still shocking, because immediately in our tradition, immediately at the death, there is a prayer which is being done by everybody. Even that can be Fatiha in Muslim culture, Fatiha. For that, there is no need to have a masjid and the janamaz and namaz and all these things. आप Fatiha कहीं भी पढ़ सकते हैं. And you would like to offer Fatiha to your near and dear. So is in every religion. At least Shanti part or Om Shanti, you can write and all this thing, you can share your grief. So you may feel still bad. He has died and you have not been informed. So these are the extreme cases, but everything has to be balanced. There cannot be any straightforward blueprint for every situation. It is your wisdom, your maturity, and your emotional maturity particularly that will help you out to solve the issue. And definitely this should not be shared on the social media. Social media should have filter. And unfortunately, there is a negative journalism increasing. Anything else?
Thank you very much, sir. Thank you very much for your kind responses to all the questions. Although we have got delayed by around more than half an hour. So, but again, whenever the information is relevant to us, we are open to all these relevant informations. Thank you, Sneha ma'am. Thank you, Zaidi sir. And thank you to all the participants for your kind and patient listening, and not only listening, I think active listening. Because throughout, even on the YouTube channel as well as on this platform, there have been continuous questions and responses and even feedbacks, all the positive feedback. And fortunately, we do not have any kind of, not a single negative feedback. So our team is fortunate enough, and we are really thankful to all the participants, to all our expert speakers, and we just look forward कि आप लोग इसी तरह से हमें bless करते रहें, and we are able to organize all these kind of meaningful activities in future as well. So with this, I conclude this today's session. For tomorrow's session, we have Dr. Rachna Shukla from Lucknow University. She will be talking on the issue of importance of mental health and well-being, and followed by a presentation by again the team members of IMHRC, who will be giving self-help techniques on managing and the ways we can improve our mental health, and followed by our well-being as well, how to take care of our well-being in these difficult times. So looking forward to all of you joining again tomorrow, same time at 5 p.m. Till then, take care, all of you. Very much again.
Thank you, everybody. Thank you, Sneha. Thank you very much. Nice meeting you.
Thank you,
Interacting
sir.
with
Same
you.
here. Thank you, team, and best of luck for all your efforts. Thank you. Take care, all of you.
भाई साहब आप लीव करें?
Yes, sir. हम सब